Good morning. I'd like to call this meeting to order. It is August 21st. It is still 8:30 a.m. Welcome. We always start with public comments. Is there any public comments? Any public comments? Okay, we will move on from that. The next is to meet with the county engineer. Good morning, Dwayne. How are you?
Good morning, Supervisors. I'm quite well. I hope you're the same.
Could you want, Tom, do you want to sit over here if Dee moves her stuff? I mean, you can move the chair back. Okay, no problem.
We have Manats and Pelling in the county still working. Manats is working on Nutmeg. They hope to have that finished up tomorrow, Wednesday.
Really?
Wow.
And once they get that done, right now they worked Saturday and got to the 205th Street intersection, or just short of that.
Yeah.
So they're basically halfway done. So 2 days to get that far. It should take them 2 days to get the rest of the way on that, and then probably 2 days on Larch. So hopefully by the end of this week, Manats will have their portion of that project buttoned up. Penalties up on 146, chip sealing that. They should finish that today or tomorrow. And then they'll move over to Brookville Road and start spreading rock on that to smooth that out and get it ready. And then as soon as Manats is done with Nutmeg, they'll drop down and get the surface on that, so we can get that wrapped up and open to traffic.
You know, they've picked a really good week to do this.
It's nice and hot. That works.
Yeah.
That material is very forgiving when it's warm out.
Is it?
It does what we need it to do. The idea of the chip seal is you want the aggregate to seat into the binder. And when it's warmer like that, it holds its temperature and really gives you a good chance to get that material down into it. So that's exactly what we need for that project. The county road crew is up doing the geosynthetic reinforced abutments for the Iris Avenue Bridge. We hope to have those completed this week. And then we'll have the ditch grading and get everything ready for the tank cars to be set in mid-September. So we wanted to make sure we had plenty of time to get that part done before they came in and to swing in the rail cars, so that we weren't rushed for time, and so we could take our time and do it right. That's really all I've got for you guys this week.
Well, thank you for that. Before we go on to item number 2, we should probably go back to item number 1. I was so excited to hear the report. We forgot to ask for acknowledgement of minutes from that.
I thought maybe I missed it.
No.
Okay, so we have minutes from
15th and 16th. Yeah.
I'll make the motion to approve them.
I second that motion. All those in favor?
Aye.
Thank you very much. Dwayne, the next thing is to set a public hearing for changing classification of the Jefferson Henry Road and 225th from level B to level C.
From level
B.
Yes.
Abby, when's the first date we can get that done?
I would say September 5th. The Tuesday after. Oh, I'm sorry.
So the Tuesday after Labor Day is the 5th.
And since that's the county line, I've discussed this with Jake Hotchkiss over in Henry County. He has no problem with it. We do need to verify Mr. Danaher's signature because it's printed.
Oh.
And he lives outside the state, so
So how do you do that?
we have a contact phone number, so we're just going to keep calling until somebody answers the phone. And then because it's a shared jurisdiction road, what we talked about is when you guys approve it, you approve it contingent on Henry County approving it, and then Henry County would approve it after you close.
Okay.
But the landowner's concerned about illicit activity going on kind of out there in the sticks.
Sure.
It's just a short hop off south of 34, so it's kind of a convenient hidden place that you can do things that maybe you don't want eyes on.
So you want a motion to set the public hearing?
First, I want to ask, is the 5th gonna work still, since we have to do ours and then Henry County does theirs? Or what time to remove it to the 11th of September?
Well, if we do ours, then Henry County would do theirs
Okay,
afterwards.
okay,
so
fine.
That should be fine.
Okay, so the 5th is fine. Yeah, motion. Dean.
Just at 9 o'clock.
Yeah.
To change classification of Jefferson Henry Road and 225th Street from level B to level C.
And that will be for September 5th at 9 a.m. I second that motion. All those in favor signify by saying aye.
Aye.
So the next item on our agenda is to discuss and consider a liquor license for This Old Barn Venue LLC. They've been in business for a year. They've done really well out there. She contacted us the other day and knew she had to be doing this, so I entertain a motion for that.
Motion to approve the Soul Farms liquor license.
Okay. Second that motion. All those in favor signify by saying aye.
Aye.
Okay. Motion passed. Thank you very much. The next item, yes.
Oh, good. I was gonna say, I guess I sit up first.
Next item is to discuss and consider appointing Teresa Tavera as medical examiner investigator. Does anybody know anything about this?
Well, I asked Abby what that was about, and it was,
There's a letter in there from.
Dr. Quinn. Item 4 is a letter from Dr. Quinn that
so he's asking to properly appoint Teresa Tavera as a medical examiner investigator. Teresa is a registered nurse at the Jefferson County Health Center in the Emergency Department and attended St. Louis University's Radiological Deaf Investigator Training Course in 2018. So, Shelley, since you're
that's gonna be sent.
here, do you know anything about this?
I knew she was gonna do it. I guess I didn't know it was a done thing yet. She works in the ER. She's super nice. I think she'll do a good job.
Okay, thanks for that. I make a motion that we do appoint Teresa Tavera.
Mhm.
Can't believe we got that right.
And I'll second that.
And D seconds that. All those,
Discussion.
yes,
I think if we are trying to memo on your motion, that it should state that contingent upon the approval from the Iowa Office of the State Medical Examiner.
Okay.
She hasn't been approved by that,
okay.
just so that we're.
No, I get that.
Yes.
Thank you, Lee. All those in favor?
Aye.
Aye.
Aye. Meet with Jennifer Stevenson with a mobile crisis update.
Okay, so in some of my committee reports, I've mentioned that there is a local crisis team, so Jennifer is here. And Tracy Liptak's also on the governance board with the new mental health agency of Southeast Iowa with me. And then Sandy Stuber, of course, we all know locally. So why don't you tell us all about mobile crisis?
Sure. Is there?
And this is something that the region's been working on for quite a while. And how we use this. And I see there's some people from Sheriff's Department on, so yes, thank you for being on.
So I'm Jenny Stevenson, the Director of Crisis Services at Elevate.
And on May 10th, we had signed the contract for mobile crisis service, and August 2nd, we were able to launch those services. So I had been hiring, training staff, doing outreach and working with law enforcement. And now that we've got the majority, not all, but the law enforcement conversations and collaborations moving on to community partnerships, schools, and everyone else. So that's going to take a few months to try to get to everyone about the services and how to be a good partner. So mobile crisis service is a right now service for a right now issue. So if someone's experiencing a crisis in the moment, the team gets dispatched. And how do you access those services? You can dial 988 or contact Your Life Iowa at their 800 number. So either option works. You will get a crisis counselor if you're an individual calling, and they will talk through things with you and then work towards dispatching a mobile crisis team, which then has up to an hour to get to the call. We work really hard at getting there as soon as possible. The staff are paid to be on call and respond at a moment's notice. So we work hard to get there, because someone's in a crisis, it feels like forever when you get there. If anyone's ever had to call 911, and during those crisis moments, a few minutes feel like it takes a long time. So we work really hard on that dispatch time to get to that location. So while if a community partner, that is, calls on behalf of someone they're working with, I just ask that all community partners identify themselves, because that crisis counselor can then just turn to a dispatcher. So you can save some time by not having to go through all of the questions, because you're a professional at the location. They'll be getting the information needed to then dispatch mobile crisis teams. So when outside of the safety conversation, and that's why our relationship with law enforcement is so important on twofold. One, I need them to know that we exist and we're out in the field, because we might need to call them for the safety of my team and the individuals that we're helping. And on the other side of that, to support law enforcement. Now, that doesn't mean that they're not doing a great job. They've been doing CIT programs and doing all of the things to try to help individuals in a mental health crisis. They don't have to call us for every call that they've been on, but when they feel it's appropriate, we are happy to come and support them, because we can take longer with that individual, or we can do the follow-up care so they can get back to policing. So instead of it feeling like sometimes it's a Band-Aid fix, or what do we do with this individual, that we're able to navigate through that with all of the community partners. So with mobile crisis service, I really see it as a community partnership unifier as well, because it takes all of us to make this program work on a number of ways. So those individuals that your clients or your consumers or your patients that you're working with, we can come and support them during that crisis, and then also referring those individuals and their families based off of their unique needs to those specific organizations or helping organizations to help them get through that crisis and back to a recovery state post-crisis. So we do follow-up care as well. So by sharing the news, everyone sharing the information and being on the same page, it really helps support that program and understanding what it is. So that way we can help everyone in need. Now, because it is through the mental health region, it is funded. There is no cost to anyone utilizing this program. Now, it's taxpayer funded, so we work hard to stay within our scope of service of what we are providing as far as mobile crisis service, but no one is going to get a bill that is utilizing, and it's for adults and children. Of course, with children, we do need we need consent from parent or guardian, but because it's an emergency service, we are able to just verbal consent from individual on the phone or from the school, or however that works with those community partnerships. So outside of that safety component, what are we doing? We are working on de-escalating the situation and seeing what do we need to do for this individual to be safe for the next 24 hours. Can we get a plan and support at home? Do they need to go to the hospital or an access center? This is a voluntary service, so of course, people can tell you to buzz off, but we work really hard to engage with them so that they don't tell us that, but not everyone's ready for help. Their family might be ready for them to get help, but maybe they're not. And we hope through our interaction that in time we're able to. So one thing to be mindful of is some of those chronic individuals that may be taxing on law enforcement or on an organization or entity. It took them some time to get to that place in their life where they are. And it's going to take us some time to work through that. But what we promise is we're going to show up every time that we're called and we're going to work through it. So it might not be a magic fix at that first call, but it may be down the road. We finally were able to get through because we're dedicated to always showing up to be with that individual and that family and support them the best the way that we can, and then connecting them with all of the amazing resources within the community, or reconnecting those resources with them as we work through that crisis. Who is a mobile crisis responder is a question I get a lot. So there's an array of what a responder looks like. So for a mobile crisis responder, it could be anywhere from a licensed mental health clinician that is working a second job to master level, bachelor's level. We could have law enforcement, off-duty law enforcement, nursing, paramedic, peer support specialist. So just depending on where they fall in that education level will determine how much training that they're going to get as well. So someone that's a licensed clinician might have less training requirement than somebody that's a peer support specialist. And then depending on their availability, they're paired together based off of that for the scheduling. So for the 8 counties, so we have the original SEAL region, 8 counties, there are 2 teams. So one team is covering Louisa, Des Moines, Henry, and Lee. And then the other team, which includes Jefferson County, would be Keokuk, Washington, Jefferson, and Van Buren. And so I have 2 individuals on call 24/7 responding at a moment's notice. So the only time that we wouldn't do an in-person intervention or have a delay is one, if that individual says they only want phone support, then we'll work hard to try to build that connection that hopefully by the end of that call, we can meet them, or the next time that they call, at least they're willing to have a conversation and we can get them connected with resources to them locally. Or if there was an ice storm or a blizzard that caused a delay in our response time because of Mother Nature. There are times which we've experienced, so since we've launched August 2nd, we've had a little over 20 calls. And we had on Friday back-to-back calls. And so in one of those teams. So that just took a little navigating because it was 2 different law enforcement agencies calling us. So when we have a community partner calling, I can split the team because there's another professional there. So that way, at least for safety reasons, because we work in pair for 2 of 2s for that reason as well. Now, where do we go? We meet people where they're at when they need us. That means their home. That means the hotel. That means the park, your office, wherever it may be. So I work really hard to, first, when it comes to safety, teaching my team situational awareness and scene safety. Those are things that aren't in academia right now when it comes to social work. So I hope that changes, but with my unique background, I've been able to provide that added education to staff, but it's new to them. So that's going to take a little time as well, but just listening to their gut and knowing we need help or we need law enforcement to let them know we're here and maybe be close but not visible. I talk about safety a lot, but there hasn't been a lot of issues, but I never want to get comfortable because that's when things could go wrong. You never know. The team has been amazing. We have been dedicated to the training process. They have been dedicated to going on those calls and really eager to go. And so with any new team, like they've got to get their feet under them. And with any new program, there could be bumps in the road. So I just ask if something didn't go quite as you expected, to have that conversation with me, because that's how we work through things to make sure we're communicating. What did we learn here? What didn't go right? What went wrong? What went right? So that way we can maneuver, because again, these responders are new to this. I'm not new to mobile crisis services. I have 12 counties in Northeast Iowa and have worked in mental health crisis services for 17 years, but the team is new. So we have a mentorship program with veteran responders, giving them all the support, but they've been amazing and talking through calls and learning and going above and beyond to help everyone and our community partnerships. Because like I said, it takes all of us to make this program successful. And I would hate for something not to go quite right. And then you just say, never mind, I'm not going to use that service. So I don't shy away from any hard conversation because that's when true learning happens and change can happen. So I've thrown a lot at everyone. Are there any questions?
We do have several people that you potentially could
Yeah,
work with in the room. Have you met them or?
I don't believe so.
Kathy, you want to introduce yourself?
I'm Kathy Jefferson, I'm a nurse as well as a paramedic.
I'm Chris Estel, I'm the public health administrator for Jefferson County.
I'm Judy Heisel, I'm base manager for the chemical gas service.
Shelley Atkinson, Jefferson Fan Hill Center. Yeah, I met you the other
Yeah,
day.
the other day when I just popped in on an office, yes, so wonderful. I do have some flyers as well. Oh, sorry.
Brett Pearl, Jefferson County Emergency Manager.
Nice to meet you.
And Brian and Bart.
Brian Thomas, ambulance director.
We've met.
Raise your hand. Raise your hand.
So how does somebody reach you if they need to call you?
So I have business cards and flyers, with my phone number. So my cell phone on my business, card, I do answer 24/7 unless I'm on vacation. And when I vacation, I don't society, I'm in the wilderness and my kids can't even get a hold of me. But it's always known when I'm gone to who to contact in that moment if it can't wait. And then on these flyers, we use them for twofold. One, we leave them with every client with their safety plan that we came up with if they were staying in their home or location. And then it also has my email address on there as well. And then we use them for information.
And I know one of these flyers has the little things you tear off. Are you gonna put these like in the grocery stores or anything?
That's not us.
What is this?
That's community.
That's in this one too.
Yes, so, but I absolutely can make something like that. So we'll be working on that outreach and some of my responders will be helping me with that outreach as well. But if anyone would like me to come talk to their team or their organization, I'll be happy to do that. So that way we can work out what our partnership looks like too, because everyone has unique needs and we want to make sure that we're very accommodating and supporting everyone the best that we can.
I just want to say that we're all really thrilled to have Elevate and have Jenny with us. But the one thing I want to make sure everybody understands is this is not a substitute for going to a psychiatric unit. If somebody, or they should not even be called if there's somebody that's claiming to be a danger to self or others, and law enforcement are aware of that. I mean, obviously, we're not going to jeopardize the safety of mobile crisis for someone that clearly needs to go inpatient.
Yep. So if they're actively suicidal or they need EMS and they need law enforcement, there wouldn't be a need to call us at that point. But there are also times where people say that they're suicidal, but they don't have a plan or a means, and we could engage them. But with our relationship with law enforcement, they could get on that scene, identify that risk, see what's going on, and then they can activate us to come as well. So if you're not sure and you think you need law enforcement for safety or because of what's going on, maybe there's some violent behavior, we are happy to go with law enforcement in those cases to assist the best we can, but we leave that up to them. The scene is theirs until.
Hey, Jenny, I just wanna get the division of the counties again, so it's
Yes.
Keokuk, Washington, Jefferson, and Van Buren, and then it's Louisa, Des Moines, Henry, and Lee.
Yes.
Is that correct?
That's correct.
Okay,
Yep.
all right, so that helps me when I go back and tell my team how it works
Sure. And
geographically.
I don't have it separated on here. I just-
Okay,
but-
all right. Thank you. I just need to clarify
Yeah,
that.
no problem.
Thanks.
And I just want to comment, we are so delighted to finally have mobile crisis in the region. It is one of the core services that was identified by the Mental Health and Disability Services that every county should have, and we have not had it until now. So we're just delighted that Elevate has made that decision and has come in and gotten started. And at Optimum, we're completely committed to partner with Elevate to make sure that the whole continuum of care is available to people. We continue to have urgent care appointments within the office, and the staff will be able to refer there. Our crisis team is active and available 24/7 with all licensed mental health professionals able to do complete assessments and determine whether they could go to the crisis stabilization unit or to another level of care, or we will be partnering with our providers in the hospitals to get them to inpatient level of care. And then we continue to have the outpatient services to follow up, and our recovery and resource center, which is also funded by Mental Health and Disability Services for that ongoing support at a very easy level for people. And we're just so grateful now to have all of that in place in the county. And thanks to Sandy and the management team for working on that to create that. And now, of course, we've expanded beyond SEAL to combine with the counties to the west as the Mental Health Agency of Southeast Iowa. And with that larger group, we are integrating, but we see what will happen coming forward is that we'll have more resources available for the citizens of Jefferson County, and I'm really grateful for that as well.
So I just want to reiterate what you said, because oftentimes I hear, oh, we don't have any services. People don't understand. So if I have a family member and this is new to me, I can either go to the emergency room, or if my loved one is not in crisis, I can call Optimum, I can call 988, Your Life Iowa. And when you mentioned that you have urgent appointments, tell us what that actually means, because I also hear, well, I can't get into a therapist for 2 months. That's not true.
That is not true. It used to be, and it is true, if you call the University of Iowa, for example, and you want to make an appointment for psychiatric care, you may be looking 60 days or longer. And we are very underserved in Southeast Iowa, and so we faced that problem in the past. But what the SEAL team recognized is that there was a fairly simple solution, and that was to create some appointment reservations every day in the behavioral health offices. And that means that when a person calls with not in crisis, but at a point where if something doesn't happen fairly soon, they're likely to end up in crisis, we can schedule them either with a psychiatric provider or with a therapist for an appointment. And that provider can then assess and help decide what could be the next steps to keep that person safe. And that makes it so you don't have to wait 60 days and you don't have to end up in the emergency department if that's available. And then we also, of course, have crisis evaluation. And that's a higher level of care for people who do have a risk for self-harm or harm to others. And that's available 24/7, either in the office or in our emergency departments, and sometimes in our jail as well. We have done those so that we can quickly assess a person and support them getting to where they need to go.
And then the other thing that I think is a barrier based upon knowing people and what I've heard is the financial component. Is that a barrier, or can people be seen anyway?
Yes, and again, that's part of our regional commitment. Urgent care appointments, if a person has insurance or the ability to pay, they would be billed through their insurance. But if a person does not have insurance and is not able to pay, those urgent care appointments are funded by the region. And again, that's taxpayer dollars. It's available to everyone. And that's the same as the crisis program too.
So I think that the messages are, we do have the services and we all need to be helpful in communicating the services are available. I'm looking at you, Connie.
I know.
Yeah, and I think what we've targeted is one of our biggest needs actually at this point is more community awareness. The providers have been stretched so thin for so long that they don't get out and market very much. And they're too busy doing the work and with long lists. And so people who haven't entered the system sometimes aren't even aware of what's there. The fact is, our county is doing fairly well. We have now, thanks to Elevate's coming with mobile crisis, all the basic services in place, and we have a really good network. Jefferson County Health Center is a wonderful partner. Our law enforcement team is really exceptional. We feel wonderful when they go out to deal with people with mental health issues because of the level of respect and concern that they show. And that system supports people, and we just need to trust and reach out for the help when it's needed.
Any questions for me, please?
I just think that contact information required should be given to their VA, general assistance officer across them.
That's-
Because he has contacts with lots of people who come in, especially our veterans.
Yeah, and the mobile crisis responders get added veteran training to working with veterans as well. I think one thing to share is when the mobile crisis responders are out, we are triaging and helping. And so if they need that higher level of care, our relationship with Optima is critical, that we can get that licensed evaluation and connection to that to continue to serve those individuals with their mental health crisis services. So it just pairing, and everyone has been so welcoming. I'm the only one that travels down from Waterloo. The rest of the team live in the communities that they're working, and I have an assistant director running the day-to-day operations, so that frees me up to do the outreach and the education. And so it'll take me a while to get through everyone, and then I'll do my rounds again and be like, hey, I haven't heard from you. If you don't need me, that's great, but we're here to help, because that is key for the awareness of individuals that are in need and the partnerships to access the service. So.
Thank you very much.
You're welcome.
You drove all the way from Waterloo this morning?
This morning, yeah.
Good for you.
Oh, yeah, no problem. I'm a farm girl, so I'm out doing chores and no big deal. Yeah, so I have these here. I'm happy to bring more and drop them off. And then I usually stay, so I'll be in Washington County tomorrow and kind of trying to do some outreach and making my rounds in the 8 counties. So, but I'm always available even if I'm not in the area.
I get some more flyers.
Yes, yes.
Thank you.
Yes. Thank you.
Yeah.
Since Mr. Kinney is not going to be here until 9:15, we're gonna drop to the next item, discuss and consider abating taxes for 1900 West Burlington. There is something in your file.
Well, Steve, what do you want to tell us?
About what, about the late taxes?
Yeah.
That's not my deal.
Well, thanks for telling us that.
Ultimately, I mean, I don't know why it's even on there. Well, the only question I really have is, was there money allowed in closing to pay taxes? And if so, should those be used, should that money be used to pay the taxes? You know, we kind of went over that with the city situation a month or two ago.
I think there was, we'll have to check. Chauncey might be aware of that, because that was before you were here.
But taxes are between the treasurers, really the treasurer and auditors.
So Steve, are you saying that if Brett buys a property and from somebody and whoever gets the taxes, the money to pay for that front?
Typically, not always, but typically taxes are allowed in closing for,
Yeah.
to pay
Yeah.
for their time, because 18-month lag
Mhm.
assessment to the taxes are paid.
And so is it really up to the new property owner to hold on to that money to be able to pay? those
Absolutely.
taxes?
Yeah, those taxes are still due
Mhm.
with the new owner, even though they didn't live there at that time.
Okay.
The Mark will still sell the tax sale regardless if it's not paid.
I think there was, but how much, I don't know.
I don't know,
Top
it'd just
of
be
my
something to
head.
talk to maybe Shannon about, or whoever was involved in closing.
Abby, do you remember?
The number $12,000 sticks in my head, but that doesn't mean it's right.
Yeah.
So, Chauncey might know.
Yeah. Our assistant county attorney is going to text the county attorney to see if he knows. What's going on.
Mark may also know, I'm not sure.
I just wanted to say thank you. I stepped out for conversations. I didn't want to leave without saying thank you for the opportunity
No
to share.
Thank you.
And looking forward to partnering with everyone, so.
Thank you.
Yes, thanks.
Let's see if Mark's available too.
Okay, would you do that? I'll skip down to the next one while you're gone. So, Steve, allow and disallow homestead and military exemptions recommended by the assessor.
So every year, the code of Iowa states that we accept all applications for homestead and military, for the homestead and military credit exemptions. But in the end, it's up to you guys to allow or disallow based on my recommendation. And so we have all the new ones. You don't sign the new ones, but I do have a handful of ones that are being disallowed. Probably more than normal because of that 65 plus ones that people it didn't work for them this year, but they still filed the application.
Sure. So they were disallowed because of age?
Just a variety of reasons, whether they don't live there, whether it's not their primary residence, whether or not that maybe they didn't own it. There's a couple in here, people applied for the 65 plus that live in a mobile home park and they're not eligible, things like that. But it is illegal for me to refuse an application.
Right.
I mean, if somebody's not
Sure.
eligible, I'll tell them up front, I don't believe you're eligible. But if they still insist, if they still want to fill out an application, I have to accept it. So.
Well, then you've got a record of it.
Absolutely, and it's fine, it's.
Okay, so you need a motion to allow and disallow these?
Yes.
I'll make that motion.
I second that motion. All in favor?
Right.
Aye.
And the answer to our questions right in front of us from the last one, it's $8,900. It's right here.
Okay, so let's back up to the abatement of the taxes at 1900 West Burlington.
So it says be it resolved by the Board of Supervisors of Jefferson County that property taxes, which normally would be assessed against the following, and it lists the property number, previous the tax statement, Jefferson County, Iowa. Is $8,900 are hereby abated for the above amount.
I have a motion and a second. All those in favor? Aye. Steve, thank you very much.
So you're allowed to discriminate against.
Yeah, maybe. Want me to all these signed? There's a stack of them, Susie, so when you get done, just sign them
Okay.
and give me a call. I'll come get it.
Yeah, it is a bit, no, we got it, so.
Right now it is 9:08 and John Kinney is supposed to be here for the broadband update. So why don't we take a moment to go to the restroom and do whatever you have to do.
There's,
How's everything going at the station?
Good, I still didn't get an answer on that other, deputy was on, I tried calling that day.
Oh, that's all right. It's all
And
right.
then whether
I
they
hope
were
it
able
shows
to
up. I didn't remind him.
Yeah, we'll get to it.
Right. Well,
Okay.
I assume
Doesn't
if
it smell
I see
good?
any other reports, any work in the statement, we'll figure something out about that.
Bart was one to talk about that ring that you had down south there.
Oh, that rave, that rave. Oh, are you talking about the wedding I went to? Or,
Good morning. Morning.
it was a fantastic time at that wedding.
Which wedding's this?
My best friend got married like a month ago, and I was the best man, so I went all the way down to Galveston Island, Texas for that wedding. Great time, but oh my goodness, man, it was like footloose at the wedding. No one was singing, no one was dancing, nothing. Yeah, so there were a total of 6 people that danced, and I was one of them. And I was going from table to table to table, asking people to slow dance. And then I was trying to coerce one of the other bridesmaids or something to dance. And I ended up going to this, all the bridesmaids. My buddy walks up behind me, he says, "Hey, Connor." I turn around and go, "Yeah." And he goes, "I'll dance with you, buddy." I stand up and I said, "Better be a slow dance." And he said, "Of course it will." And I said, "All right, bet." So we were starting to walk over there, and I turn around and look at the ladies, and I say, "See, he knows what a man wants." And we did a slow dance. It was hilarious. It was hilarious.
Hi,
Is there alcohol?
have a seat.
No, there
We're
was
taking a little bit of a break and then we're ready
Oh.
for you, okay?
Sounds good.
I wish there was.
Hey, Bart, should we tell him now or later that he was on camera here on Zoom? Should we tell him he was on Zoom?
Yeah, that's still recorded.
Yeah. How are you today?
Oh, doing all right. Yeah, busy.
Everyone dispersed, huh? That's good because Chauncey didn't know whether or not they had paid taxes at closing. You figured it out?
For the 1900 West Burlington, we did figure it out.
Because it's a county building.
Yeah, it was actually in a.
Oh gee, what do you know about that? Do you recall when it comes to two-factor authentication, did you allow for authentication via a landline in your resolution? Or was it only for people to use their cell phone? I do not.
Yeah.
It's just, they just got asked Abby. So she can remember
Abby is,
Are
Shelby knows, maybe.
Oh.
You don't think that the board has the regulation?
I want to think the driving course, I think.
No. No, but this is like.
Oh.
Rescue 17.
What I normally do my entire life.
Hey.
Okay.
Did your neighbor?
No.
You're not leaving, are you?
No. No, not yet anyway.
Early child.
How are you doing?
You want one?
Oh, not bad.
Oh, he does. If you ever
Yeah.
need them, I got the wide ones, I got the skinny ones, I got the little ones, I got everything.
Oh, I can believe
I
it.
have to say,
When do you guys think you're gonna get those towers all put up?
Yes, sir.
Contractor starting right after
So the beginning or after?
Yeah, that's taking a lot more planning. than we
Okay, we'll continue with the meeting now. Move up here, guys.
Yep, sure.
hi, so you were,
Thanks for coming, John, from Nate.
Yeah,
Here, Maytel,
thanks for
whatever.
having me.
are you still Natel or Liberty or what are we?
Nato. Yep. It'll be that for quite a
So
while.
what's the progress in Jefferson County?
So Jefferson County, we've had the B Street water towers connected and we're testing right now. Having really good results. Like I said before, it's new technology. So the results are actually a lot better than we thought they'd be. So we've, the summer still kind of running through the design and contractor acquisition phase and all that. So we've selected the contractor that's gonna start putting up the bulk of the remaining towers that need equipment installed on them. That should take, we're thinking about 2 weeks per tower, maybe a little less if the contractor can move quick, it depends on the weather and that kind of thing. And then it won't be very long after that, we can start connecting all the customers.
So how did that happen? People know because when we Had talked with Mike about this, wanted to make sure that people weren't going to be charged like an extra fee, you know, if they needed a pole or something. We worked on that, so how will they know that?
How will they know if they need like a custom installation, or we'll have to go survey the site and, you know, figure that out on site. As far as charging them extra for it, I don't really anticipate that being something we would do, unless it was something major, you know, if they're way down in a hole, or we'll have to figure something out. But
Well, when we worked on the agreement, we made sure that that would not happen because part of this grant was last mile.
okay,
What is it? I'm not using the correct term, but last
know what you
mile connection.
yep. Yeah, so if that's the case, then yeah, we won't do that.
So I looked up on the OCIO, like the report that was given, because you have to report in there, and it calls it a Jefferson Henry County application. So how many of the homes are in Jefferson and how many are in Henry?
I don't have that exact data with me, but
Could you send that to us?
I
please?
could, yep, I can do that.
Can you send that to me when you get it?
I'll send it, I can send it to you. Because I know Henry County didn't put any money in, so I just want to make sure
Right,
we're not paying for them.
well, Jefferson's the priority, so over it, definitely, so, yep.
Lee, do you have any questions?
Yeah, I do, I'm trying to. So, back to what Dee said, and I don't have it in front of me, and maybe Dee's got it, but I think part of the grant that NATEL received, it was $100,000 set aside in that grant to provide connections to the residents. And it was my understanding, and maybe incorrectly, but it was my understanding that that would facilitate those connections for those folks out there that wanted it.
Right,
That there would be no additional charge, that's what the $100,000
That's
is to
correct.
cover.
Okay,
but we want to make sure when you get to that point, because when I see the ads, because I'll see ads either in social media or wherever. And I know it's probably too premature because you haven't really rolled this out yet, although
Right.
people keep calling me going, when's it gonna be available? Because they're interested.
yep,
So how are people gonna know this is part of that and that they're not gonna receive this extra charge? I
part of the
guess?
grant.
Yeah,
I don't know that I want to advertise that necessarily.
and
Because
that's understandable,
that
but
can
we
get
wanna make
confusing.
sure that those folks aren't being charged,
right,
so.
I don't know what guarantee I can give you until the time comes.
Sure, just keep us,
Keep you
you know,
informed.
even if it's an email update, just let us know what's going on, if you could, that'd be great.
Yeah, yep, that's no problem. So I'll make sure to do that. I'm thinking it's gonna be probably October before we're able to
Okay.
start with customers in Jefferson County. But, you know, when we've kind of been in this, we're trying to figure out, what exactly Mike agreed to before. And B, this is new technology, so we're trying to figure it out as well.
Right,
So that's kind of why we've been in this holding pattern, you know, working on it throughout, but once we have more details, things are really starting to roll. There'll be a lot more to say, I guess, a lot more updates, so. Yeah,
So we look forward to continued updates.
yeah, understood.
Thank you very much.
Yeah,
thank you.
all right, thank you.
The next item is to meet with the ambulance director.
Hi, Brian.
Morning, Brian.
Hey, how's it going?
So what are you up to this week, Brian?
Well, interviews and onboarding. Schedule.
When you say onboarding, what do you mean by that?
The insurance company, it requires a lot of paperwork, a lot of going through different insurance companies and making sure we sign everything properly. And we meet once a week to where there are certain things we need to meet, certain criteria, and they just want to make sure everybody's tracking. That'll go on until January. And it's an hour each week on Wednesdays that we meet. So we just want to make sure we're on the same page and ready to go live, if you will, for October 1st. So it's a daunting task, but we're up to the challenge. We're getting it done. Currently, we have 5 pre-employment scheduled this week, 8/29 and 8/31. We have 14 currently. We have 6 EMTs, 8 medics. We got an interview today at 1. 4 interviews this week, includes 2 EMTs and 2 paramedics, which is really good. We have cardiac monitors arriving today.
Good.
So we're going to get those, make sure everything's good with that.
Brian, would you, I'm slow today.
Yes.
Repeat the number of hires, potentially interviews.
6 EMTs.
6 EMTs?
That's right. And 8 medics, which is really good for paramedics because, we were kind of lacking, but everything's seeing better.
What kind of a pre-employment physical will they have?
Well, currently they're going through the hospital where they have the non-DOT drug screen, and then they meet with provider. They also do a functionality test, which there are certain steps they have to do, such as lifting and bending and things like that.
Have you connected with Elizabeth about that?
Yes.
Yeah, we've been in touch and I got some more, sorry. I don't
No,
want to
no,
jump all
quite
over
right.
you. I talked to Curtis at the hospital this morning because I just wanted to make sure that everybody's on the same page. I know that this was something that I brought to the board's attention because it had been discussed in the safety committee meeting, just what pre-employment assessments are going to be done. And then spoke with Dee about it. And we were talking about maybe getting the same type of assessments done for the ambulance personnel that are done for public health. I spoke with Curtis at the hospital. He said he wasn't certain what they do for public health, or even if the hospital provides those at all.
It's been 7 years, so yeah.
So
they
maybe,
did.
yeah, he's
Yeah.
like, do we have an agreement? I don't know. So I don't know. I mean, at the baseline, we were thinking a back assessment, general physical, and
Right.
then
That
the
and then
drug screen.
correct, and that's already being done. We're going to sit down with physical therapy sometime this week, maybe add a couple of things into there. With training coming up the 14th, 15th, and 16th of September, we may, if we have the time, do a couple of things that ambulance people do,
Kelly's
such
not
as
in here.
taking things out of an ambulance stretcher. 150-pound person on there and just making sure we have the proper mechanics, because that's important. But
So how many of those pre-employment physicals have you done so far?
well, we got 5 this week. So far, we've knocked out 2, which we presented here in a little bit. They've all gone through the process. Everything's done with that. I have 5 scheduled this week. So, and a lot of those, it's hard a lot of them have jobs. So it's scheduling issues, and also scheduling with the hospital and making sure, their schedule's open and making sure those times align with the individuals coming in. So it's more of a logistical issue.
Maybe before those are done, maybe we just meet and maybe even have a conversation with Chris about what they do at public health and just make sure that the
Okay.
hospital knows what should be done. And
And they will. Well, you know, being that we're on a time crunch with 43 days left, we can adapt that in, hopefully, but we really can't delay.
right, no, I'm
much.
not trying to delay at all,
Right.
just make sure that everybody's on the same
Right.
page.
And then I talked with, you know, I reached out to Stacy Griffin.
Yeah.
We had several conversations. I was under the impression that she was going to provide
Yeah.
something, and no. So it's kind of disappointing. Currently, we have, we're uploading image trend documents such as rig checks, personnel files into image trend. That is that's a task in itself. We updated the CQI policy, and I'll be uploading, or I'll be sending that to Jacob Dodds. Our protocols are done, which
Do you mean your policies?
no, the CQI policy we had updated, such as change some language, things like that. And Jacob had pointed that out, and that's complete. So that'll be sent to him. Protocols are done. I'll be sending them to him, Jacob, in a zip file, and he'll be uploading that.
Are those what you worked with Jack on?
No, ma'am.
Okay.
The protocols are from our medical director.
Okay.
Allows people to do what they want. We are working with Jack and going through those policies as well. And again, I'm setting up a meeting with him to where we can finalize.
You know, we all need the same glossary. I'm just trying to make sure we're using, I understand the terminology from which step of the process.
Right, no, understand. I met with Katie. She's completing a new pharmacy agreement because we're going to a combination. And as soon as she gets that paperwork back to me, I'll be sending that on to Jacob as well. And we're also working on the medical agreement with our medical
So
director.
what did we end up with the hospital on that?
We're going to do a combination to where we have all the non-narcotics and they have all the
Oh, good.
narcotics.
That will
And
work
so
then.
we're working on the logistical issue is how many bags we need to have on standby. That way we're never short. We're in the process. Again, it's more logistical as far as getting everybody on the same page and timing and things like that. Nothing happens overnight like I would like, but it's getting done. We're moving forward. And we're currently working on scheduling for the 14th, 15th, and 16th as far as an agenda goes. Inviting
In September?
Yes, ma'am.
I thought you were gonna start people on the 18th of September.
They'll be coming for skills for those times, and those times had to be adjusted for our medical director. They're not starting, they're coming in, they're gonna be paid for the 14th, 15th, 16th while they're here. That's correct.
Well,
At
then
what
they-
rate?
Then they need to start.
The various rates now that we will agree to as far as hourly. Yes.
And so Susie's dumb today.
Okay.
Why couldn't we just start it on the 18th when we were originally told they were gonna start?
Well, the training has to correspond to when our medical director can be here. Also for housing purposes of where we're going to train all these people. And when Image Trend and the billing company can be in. So.
How is Image Trend ready to go down?
Yes, we're working on Image Trend, but Image Trend, as far as them coming in and helping to train our people is important. Billing companies do, as far as filling out paperwork, is important as well.
So that's part of the fees that we pay to these companies.
That's
They do
correct.
on-site
Yes.
training.
That's correct. And it's just a matter of when they can be here. It's hard to get
So,
Everybody on the same page with.
so you were juggling Image Trend with your
Billing company,
billing company with your
medical.
medical director.
That's correct.
That's quite a feat.
It is. But it's getting done. And then I think that's about it. And the two individuals that I'll be presenting to you today have been, I've already gone through the process and looking at bringing them on September 1st to help us fill in the gaps and get training materials ready. and
Which
things
brings
like
me to
that.
another silly question.
Sure.
Who's doing your background checks?
Bart?
And he's done 2 so far?
Yes.
Have you got it?
Have you?
I haven't done any actual background. I provided them with a way to get criminal history. I can only provide local charges. I'll run it through the database.
Right. Not before.
And
Is that
then he
really-
has a DOT site. They can come in and request a driving record, the Iowa
Right.
driving.
And we
record.
have their driving record and we've already parts of the billing company as far as having them vetted for insurance fraud, things like that. And they're very fast.
Bart, is that similar to Iowa Courts Online?
Anybody can look at that.
Yeah, I know. I do.
But there's two different sites. One's driving record and one's criminal history.
Okay.
Criminal history has come from the DCR. I'm
And
not
you've done
allowed to
that.
run it on ambulance personnel through the database. But
I just
they
want-
can for a $15 fee,
Correct.
get a complete
just want-
criminal
yeah.
history. As with the DOT on the driving record, they can come to us, request it themselves. There's a $5.50 fee that goes to the state. Or they can go right through the DOT site.
And that's what I had them do, was go right to the site and provide the information to us.
And
So then what does the billing company do? They're doing, are they doing the same thing or is it different?
No, they checked with Medicare and Medicaid federal agencies to make sure there was no violations or anything like that. And that's part of their onboarding process. And then as we get people vetted and bring them on to have them pass, we'll upload them into their file and they'll check every person from Medicare and Medicaid.
Brian, can I ask you a question? Susie, can I ask Brian a question?
Yes.
Is that with the Office of Inspector General? Is that the OIG check for
Correct.
providers?
Yes.
Okay. Okay, and then so is the background check like the same background check that does dependent and mandatory dependent adult and child abuse? Is that part of that part? Is that what is known as a same background check? I'm just trying, I
I'm
don't know.
not sure what that
No, that,
you're checking on. No,
Yeah.
ours is a national database. They would come up with a complete criminal history.
Okay.
Whether they were charged, convicted, complete.
Okay.
Isn't yours a healthcare related one?
No, ours is criminal too. I mean, it's not to the level that Bart has. It's saying it's a program that you can that you can pay to, yeah, that's what I was just asking.
Yeah.
Did you wanna make sure that it's
What's the
like?
fee on yours?
Well, we did, like, when, we haven't had to hire anybody for 7 years, but you fill out the employee fills out the form with their name, date of birth, social security number, any alias names, previous names, and then you submit it through this portal with the state, and it flags any kind of, dependent adult, child abuse, any kind of,
sex abuse.
drug charges, sex offender, all that kind of stuff, so it must be the same thing, except you gotta hire, I'm just trying to get
It might be
us.
the same. Are you going through the DCI website?
Yeah,
Well,
yeah,
it's probably
same.
all the same.
So I'm just asking for clarification, so everybody's on the same page. is my
and then we go through the Amanda file, the
Yeah.
video portal and double checking to make sure there's no under investigation.
So this is similar to how you researched Judy before you hired her.
Yes, ma'am. She's clear.
I figured that or she wouldn't be working.
Right.
I just want to make sure we're treating everybody the same way.
That's correct. Yes, ma'am.
So I had a question about, when we received the funds, have you been able to, and I know this comes later, so you got too much to do right now. as far as where the revenue goes and work with Shannon on that?
Yes, Shannon and I are working together. on that.
Okay, if you'd be able to reach out to any other counties.
And talk to Lee County, yes, ma'am. I have,
Okay.
as far as setting up a bank account and coordinating with the staff.
I've got something I'm gonna send you. I just got it Friday. It called Washington County.
Okay.
And I happened to talk to their actual coder. Who
Okay,
gave a wealth of information. You might want to give her a call.
yeah, well,
And she sent me all the accounts like they have set up,
right, well,
that kind of thing, which
a lot of
But
this,
do
I
they
have,
do third-party billing? Or do they do
they
their own billing?
have, but it doesn't matter because your revenue is gonna go to the general
I
fund.
understand that. That's not the question I asked, but there is. a
Would you repeat the
difference.
question?
Yeah, the question was, are they using a third-party billing?
They have in the past, but they have their own coder now. But as far as when the revenue comes in, it doesn't matter. You have to decide where it goes.
Yeah,
And I'm talking about where it goes.
I
I'm
know.
not talking about
And
that.
he just told you that he had done that.
Yeah, can I see what you've come up with codes and how it's set up?
as
That's
far,
through the billing company. We don't set up those codes.
our billing company.
No,
does
not
it.
the actual billing codes. I'm talking about the revenue. So,
Yeah.
so what she told me, and I'll send this to you, is like you want to keep track of your Medicaid, your Medicare, all of
Right.
those different.
That's all
kinds.
done through the billing company that provides us what is paid from what.
Then
and
how do we
much revenue.
physically at the county get the revenue? Do they write us one check once a month? Do
Well,
they
I had to set up a bank account at Midwest One.
Did the auditor's office help you do that?
I did that because they wrote a loss of how to do that. But I set it up under the umbrella
Just so
of the
you know, he
auditor.
was directed to do that by the treasurer.
That's correct.
Revenues are not the auditor's office. I just want
Okay.
to put that out there as well.
Yeah, I
Correct.
just thought Shannon could help with those.
Well, that was kind of a fight in itself, but everything's set up decent and in order and to make sure that the funds go where they need to be.
Brian, we just have questions.
No, I
Yeah.
completely understand.
Yeah,
Did you spill something, Lee?
No, I dropped the coaster. But you didn't see it, so it was his fault.
so when this
Liz was-
comes up at Midwest One, are we gonna get a report that says, rather than like a total amount, how much was each?
That's all through the billing company now. They provide us with what's coming in and things like that.
Does Lee
from-
County use a billing company?
Yes, they do. I
I
checked
believe
with
so,
them
yes, ma'am.
before we ever started this, before Brian was ever here, that they use.
PCC,
Yes, and then they charge 6%.
correct.
But yes, they use a third party billing, but I'm assuming that if the board wants, I don't know the answer to this, but I'm assuming if the board wants a running record on a monthly basis, that the billing company can provide that. to
Sure.
us, right, in the form of a printout or something.
And this will come later. I just wanted to try to understand the end of process because I think it's important.
Yes, we won't know as we're doing this onboarding process about what's being reported. I know they break it down for Medicare, Medicaid, and what private insurance is coming in. They'll run a report and we'll get it in probably September, or I'm sorry. 30 days after we've been up.
And then we should get a report, shouldn't we, from that other thing, GEMT?
Mhm.
Or will that come through the,
That's
I don't know,
separate.
we're a year out before we get that.
That's correct. 6 more months, we'll be getting reports from them, from the state. So I know the billing company is working with them and it's a ongoing process.
So basically, I'm done here. The billing company is gonna handle all your billing. Nobody on staff is gonna do any billing, is that
Well,
correct?
we're gonna double check with them as far as what we got coming in and they show us what monies are coming in from different sources.
And who's going to be responsible for that?
Myself and Judy. Yes, ma'am.
So tell us more about this. Maybe let's get Mark. I want to learn more about the bank account because this is new for the county
Right.
to have something like this. Yeah.
So when your folks, your ambulance folks come out, the paramedics, EMTs, when they're
Yes,
sitting at that counter, or standing at that counter,
yes,
inputting stuff.
yes. What about, they're just doing
They're
patient,
gonna, okay.
patient reports. They do not see all the revenue coming in.
And will you be checking those to make sure they're correct?
The CQI, yes, ma'am, and I'll be handling that.
I see Judy back there nodding her head.
My number 2, yes.
You know, Brian, we have a lot of questions.
No, I
Just
understand,
want, you know,
and it's that's a lot of information that we're dealing with on a constant.
Well, yeah,
basis.
you guys have had a lot of information. So,
Yes, absolutely.
you know, I get that. I get that. Let's wait till she comes back. Give a nice weekend.
I cleaned my garage. Starting work on my.
I'd like to have a dollar every time you talk about that pool. Huh?
Telling them the work better get water.
If we were in Southern California, it might have water in it. Yeah.
You know what amazes me is the Palm Springs flooding.
Eric Stratton, Vice Chairman. Glad to meet you.
Hey, Mark.
Oh, boy.
No, you're not in trouble. We're just all need to hear the same thing at the same.
First time for everything.
So
We're
we're
not in
gonna,
trouble then?
sounds like the ambulance is gonna have an accountant in Midwest one.
Correct.
Okay.
And tell us how this happened.
Well, I went to Midwest one after we talked.
Okay. And they got you set up.
Got me set up.
Okay.
And so we're under the umbrella of the county, if you will.
Okay.
So funds will be going into there and then, yeah. so.
Okay.
So since this is something new for the county, like, will you, how does it get audited and all that to make sure we're okay with?
So the ambulance part's new. Having an account for a different department is not. So take like Bart, for example. Bart collects funds for
Sure.
all kinds of different things. He uses an account number that's given to him by the auditor's office, namely Shannon, I believe. And then he brings those funds, or somebody from his office brings those funds to us. We then receipt them in and we give him a copy of the receipt.
So then Shannon will need to give you an account number for her.
That's correct.
All right.
Yeah, because they're gonna have electronic funds that are deposited from insurance companies, things like that.
So Bart, in your account, do you write checks on that or does somebody write checks on that?
There's one through the civil office that we do. Sometimes it goes outside the county to another court or something, court fees or something.
All right.
And,
'Cause-
you know, our civil girls could explain it better. I'm probably hacking it, but yes, there are certain money collected, but it's owed somewhere.
Somewhere else.
Yes.
So how does the auditor's office track all that? I just want to make sure in the future audits, we're.
I can speak to that when we had home care. That's
Yeah.
my area.
Yeah.
Okay, so let me just, we don't have certified home care anymore, but historically, this is what
Right.
happens. So we're so old, we used to get paper checks from insurance companies, but then everything went to electronic deposit. So that was deposited in an account in the treasurer's office. Okay, so I would have accounts set up, numbers given to me by the auditor's office for revenue. We have revenue numbers and expenditure numbers. So if I got a VA check, a Medicaid check, a Blue Cross check, whatever check was coming in or deposit, I could track it and it would go to that line item for revenue. And so we wrote no checks. Every time we had to write a check, we had a GL number for a check request and an expenditure line item. So everything was covered. we didn't keep any money in the health department. Everything was under the umbrella of the county, underneath the health department GL numbers, whether it's a revenue or an expenditure
See,
code.
it seems like
So-
ambulance should be the same
I
as
can't
that.
speak to that, I'm just telling you what, and it might, there's a lot of electronic transfers that come in and out of the county though.
You know, I will say this,
There- And it's,
public health's been around a long time.
What is?
Sheriff's Department's been around a long
Yeah.
time.
it did get a
The
little.
parks have been around a long time. The thing is, they have experienced many years.
Yeah,
The ambulance has not even 6 months.
right, it would
We,
get a
we just
little,
want them to do it right.
it would get
Yes.
a little confusing, and it might have been before Mark, when the VA went to electronic deposits, because it comes in and they have to, it doesn't say, this is Jefferson County Public Health's $1,500. I mean, they're all numbers, line items, so if we knew we were expecting a big check deposit or revenue deposit, we would call the treasurer's office and say, hey, we should have a big check coming in for whatever, so then they would be able to flag it and see it, because sometimes you don't know, it could have been for Ray for VA. See what I mean? It doesn't flag it, so you don't know all that, and stuff has changed, but it was. a
Yeah, we
pretty-
don't do any of that anymore.
Yeah, see, it was a pretty transparent process, and there was no checks written out of my department. But the only checks that come out of my department are the ones that I request from the auditor's office. So I don't know if that helps clarify some stuff, but that's what we've been, for 15 years, that's how we've done business.
It's a little clear.
You don't anticipate writing any checks.
I do not.
Yeah, I don't think there's a
I mean,
reason. I'm
revenue
just
comes
trying to
in,
cover the
You
bases.
would do like.
Yeah.
I don't know. She submits a claim for something.
Yep.
It goes to Darcy,
Right,
and Darcy cuts the check, and we see it here.
right.
And then you get revenue reports,
From
just
the
like the
billing
engineer
company.
does. The engineer gets money that comes in from the DOT, from the feds. And it's routed to wherever it's routed, an electronic funds transfer of some sorts. And the engineer submits a claim. He doesn't write a check for a maintainer. We do. And this is not gonna be any different.
Anything that requires, if insurance payments or anything like that from us, the billing company handles that. That's part of it.
But I guess I wanna, we're in fuzzy one, is from the bank account, how does the revenue get communicated with,
I'm currently working on that now.
whether it's Mark or the auditor's office? Because somehow doesn't that loop need to be closed so somebody knows?
We'll have to receipt it.
Yes.
Okay,
Because your billing,
What
our
our office provides.
Yes.
because your billing company has to have a place to designate to it.
right.
And
no,
by
I get
doing
that.
it with a bank account,
Mhm.
that keeps it separate from all the other. Then after it gets in the bank account, then from the bank account, it can get deposited into the
To
revenue.
wherever.
Would you,
Whatever
would you
you
just
want.
say,
Yeah.
Abby?
Our office provides the numbers.
Right. And I talked with Shannon on that on Friday, and so we're all trying to get things set up to where everything is smooth.
But it's just an easy way to keep track of it in one thing, one
Mhm.
place, rather than it coming into the courthouse.
Right.
Right,
Mark
no.
saying, okay, where's this go? We can put it all, say, here you go, Mark, this is what we get for this month. and
Right.
this. And then the billing company can have a printout of everything that was deposited in there. They'll have a line item saying, these 9 people, this is what it is. This is what the money comes.
So again, help me be clear on this. The supervisors gave you a budget.
Correct.
That is all you can spend until we amend your budget.
That is correct.
This money is gonna be sitting somewhere in an account, right? Or am I wrong?
How are
One
we?
that he
Are we
created,
burying
yeah.
it? What's going on?
Well, one that he created, and then they'll receipt it to us.
Yeah,
So is
so
that,
nobody has any authority to spend any of that until we do the next budget year,
Right.
unless there's an
That's
amendment.
correct.
I just, sometimes I feel we all need county government 101 once in a while, again, every month. Anyway, thank you. Just my question.
My thought behind the account was set it up just kind of like what she said, because I have no way of knowing when something gets deposited from them. I have no way of knowing what it is, what account number it is. That's not my deal. That's theirs, their responsibility, their data. I don't want to
It's
dip
their
my,
billing company's problem.
I don't want to dip my finger into what they do. But conservation set it up kind of this way too. They have an account for like the cabin fees, things like that. He can write a check a week, a check a month, whatever, with that checking account to Jefferson County for the amount that he's gonna then deposit with us,
Okay.
using the number that Shannon gave.
Code or 6 revenue codes,
Yeah,
however you need it broken
right.
up.
Like what public health does when they bring stuff over, they've got a stack of checks and we break it down depending on what line item they want. And then it gets,
For grants, yeah.
yep, and then it gets receipted. That receipt goes to the auditor's office, put in the box for them. And then everybody then has, sure, they're all on the same page.
Because when we do our budgets, we have an expenditure for whatever grant and then a revenue for whatever grant.
Yeah.
And sometimes it should even out, but sometimes it's a little wonky depending, but then you can track your preparedness grant, your local health grant, your immunization grant with an expenditure and a revenue quota.
So to answer Lee's question, yes, he could, or the ambulance department could write a check with that account. But
to you,
that check should be written to Jefferson County. That should be the only thing that they, and maybe I'm speaking out of line here, but that should be the only thing they write the check
yeah,
for
that's
is
what I want to be clear about.
to the county.
Or there can be fund transfers.
Absolutely.
because We are,
Yeah.
US fund, and when I talked with the bank manager, she said that can be very
Mhm.
easily done. That's why I.
Yeah, absolutely.
Underneath.
So what do you mean fund transfer?
Electronic fund transfer, so they can pull from that account, put it into the treasurer checking account.
Yes,
In the EFT.
correct.
But there would be some sort of paperwork to know where it's being deposited.
Well, yeah, that way.
We would see the deposit and then we would receipt it based on what they give us. Hey, this is how much money that's gonna, is gonna be transferred to you. This is how it needs to go. So yeah, they don't have to write a check, but some people prefer it.
Yeah, well, I appreciate this conversation because we're all hearing the same thing, same time.
Yeah.
We won't remember the same thing sometime.
It's recorded. You're fine.
That's right. I'm recording all of this. My own personal recording.
Chris, you want to say something else?
No.
That's
no,
unbelievable.
I don't. I'm just telling you what we do in the health department.
Okay.
I thought it might be helpful.
With my proxy for early childhood.
No, thank you.
I-
Not today.
It's 10 to 10, didn't bring it up to 10.
Anything else?
Kathy, is there something you want to say?
I was just referring again that, the building company can give us a lump sum, but that was.
Yep, I got it. I got it.
Yes.
Okay. Will that be monthly? Will that be yearly? Well, how often will that be?
Monthly. Yes, ma'am.
Okay. I'm just anxious to see how much money we're gonna be bringing in from that thing. Monthly, in a positive amount.
I'm anticipating up to 35.
Yeah, I knew you'd say that.
I was at about 236.
Okay.
Right.
Any other nagging, lingering questions?
So yeah, is Chase Elliott gonna make the playoffs?
Who?
Chase Elliott,
Who?
evidently not.
Yes.
You quit throwing.
Make a note, Abby, we need to bring napkins in here. When one of the supervisors spills his pop.
I haven't spelled it yet.
Anyway, I want to talk about training.
Yes. You good with me?
How many, we're not good with you, but we're done with you. Thank you very much. Thank you. I knew it. How much training do you need to do?
3 days worth.
Well, okay, but what kind of training?
The training is skills testing, admin such as image trend coming in, billing company.
You're gonna train your folks on image trends, that's what you're saying?
No, image trend's coming in to assist with that.
Okay. Image trend's going to train your folks on image trend.
Correct.
Okay.
And how to do all the paperwork. billing companies coming in to make sure that they know how to chart and what the billing company is looking for as far as verbiage goes,
Mhm,
how to write the charge properly,
mhm,
and how to submit things as well.
mhm.
Jack's gonna come in and talk policies and procedures from the county handbook as well. We're gonna be conducting EVOC, medical directors coming in to look over all the skills they're gonna be doing, making sure they're up to par and her standards.
Sure.
And I guess that's pretty much about it. We're putting the schedule now together.
So my follow-up question is,
Yes,
during your job interview, you said you could train. What are you training? Which one of those are you training?
I'll be conducting a skills test.
Okay.
When I'm
Okay, what about your conversations with the hospital and Shelley? What are they training? What are they helping you with?
They'll help out with some classes. And me and Shelley haven't talked about too many classes, but this is all onboarding as far as bringing in the medical director. She wants to know that they're competent in their skills.
You mean she's gonna see if Shelley's competent?
No, ma'am. Our people are competent people in the ambulance.
Mhm.
So
Yeah, I was just wondering, because I know the hospital volunteered to do some stuff.
Right, we do the CPR, the advanced cardiac life
Right.
support, and the pediatric advanced life support.
it's, yeah, this is just the ambulance skills so that they know what they're doing.
Uh-huh.
Is there like, after an ambulance call, is there a definite timeline of how soon the chart should be complete?
Within 24 hours.
Is that gonna be stated in the policy?
It is, man. It is. Sooner, I prefer like, an hour or so. Afterwards, they're not busy.
Okay,
We require a patient care reporting and data submission policy, which they've submitted. That, because it's within the state administrative rules that you have to provide a copy of the patient care report to
That's
the
correct.
receiving hospital within 24 hours.
Since the state is on image trend, that's what we got image trends and it goes directly to them.
have you sent Jacob your policies yet, or?
Yes, ma'am, he stated.
Yeah,
So you've
that-
got them all?
I still need the pharmacy policy and the
Right.
protocols.
I'm sorry, I know the pharmacy, I got Katie's coming in today and the medical director, which we had, you and I discussed. And what other things, sir?
The protocols.
Those are done. I'll be sending a zip file to you
Okay.
for that, okay?
Can we talk to Jacob over on this stuff?
Sure. One more question with the training. What about your base manager? That is in her job description to
Well,
train.
that's correct.
And
but
what is she training for?
She's gonna be doing a skills test as well.
Same as you?
Yes, ma'am, that's correct.
Anything else?
How many skills?
We're looking at that now. We're still working on how many skill stations there are gonna be and what they need to pass in order for them for the medical director to bless off on this.
Does the medical director determine those?
No, those are based on the protocols.
Oh, okay.
And since it's under her license, it's important for her to bless off and say, okay, this paramedic is good to go. I trust them to adhere to my license and what's stated in the protocols. It's just a verification to make sure they know what they're doing.
We call it staff credentialing.
I'm sorry.
We call it staff credentialing.
Oh, okay.
So for instance, a paramedic can perform endotracheal intubation. So the purpose of this is that not only can they perform endotracheal intubation, but they know how to use the service's specific equipment. They know how to use their cardiac monitor. They know how to use, if they have a intraosseous infusion device, they know how to use that and insert it. It's verifying that they, they're core competencies that they should have as part of their training, but it's ensuring that they are competent according to the medical director standards and that they can use the services equipment.
Correct.
But this doesn't have anything to do with, well, so I don't know what the word is I'm looking for, Jacob, but I'll use the term requirement for
EMTs and paramedics to keep up the certification. That's a different.
That's not
That's-
to
Yeah, that's
to
continuing
see.
education.
I'm sorry, what?
That's continuing education.
Correct.
Yeah.
Yeah,
But this is not that.
no.
And that's every, what, 2 or 3 years? No.
2
For
years.
License renewal is 2 years, yeah.
Yes.
But how many hours do they have to have?
It's CE dependent.
Okay.
Sometimes it's only an hour, sometimes it's half an hour, sometimes it can be 2.
It depends on whether they're an EMR, an EMT, an
Correct.
advanced EMT, a paramedic. Paramedics have to have 60 hours. EMTs have to have 30 hours. And it's based off of the National Registry standards. So basically, if you complete National Registry certification every 2 years, you automatically.
So they would have to have an accumulation of 60 hours over a 2-year period prior to being able to renew.
Yep.
Correct, yeah. Some
Yep.
people do it throughout the 2 years, some people wait for the last minute and do it a couple of days in advance. But, as far as training goes, I know that y'all say it's in our job description. We don't have the time to conduct training and do all the admin stuff we got going on. We can
You're gonna have
assist.
less admin stuff to do once you get up and running, because all this initial stuff will be done.
That is correct, but I still gotta maintain what's going on, and I got reports to make sure I'm accountable.
And I think the actual training, isn't that in the base manager job description?
Well, it is. Well, that is correct, but she's gonna be busy as well. That's why we bring in people to help out with training. We don't.
I'm not sure that, and I've said this before, I think, we didn't plan for that when we planned for a base manager and a
Well,
director position.
Right.
Because I know other counties like either have one or the other, depending what you call it.
right.
And then they might have like a shift supervisor or a operations supervisor, whatever
And
they call
and
that.
training people as well. But I invite y'all to come down there, come downstairs and see the
Do you
amount
have
of.
room down there?
Yes, ma'am. Well, but no, seriously, I invite you to come down, see how busy we are. We're here till 11 o'clock sometimes. This is a monumental task.
We know
It
that,
is that,
and
but
we're
we just,
talking about after things get up and running.
Oh, yeah.
You're not gonna have all these policies to write, you're not gonna have all
That's
this
correct.
stuff to set up.
There's a lot of things in job descriptions, yeah, I can do some training when I have time. But I don't have that time right
Well, and I think, and I don't have Judy's job description right in front of me, but that position
now.
is.
She
heavy
does,
on training.
Judy does a lot, okay? She does a lot. She takes work home with her. She does a lot.
Correct, because we're starting,
Right.
So tell me, what is it that you envision? What is it that you're asking? You can't, okay, so you focus on this word training, and let's be clear.
well, and
Let me speak.
all right, let's be professional and calm.
Well, I'm
okay?
trying, but it's pretty difficult.
Count to 3, it's okay.
Okay, 2, 3. The point is that certain people are qualified to train certain things. I don't know what that is. I can't do CPR too. I can't, well, I'm not saying that they can't. And I don't know if there's a state requirement for certifications to be able to teach certain things when it comes to continued ed. Are you talking about continued ed? Okay, once you get through this training process, we're bringing, like you just heard him say, they're bringing in the billing company, they're bringing in Image Trend, they're bringing in Dr. Marino, and whoever to, they've never worked with this billing company before, or Image Trend, and I guess Image Trend is connected somehow or another to some extent with the state. And so those trainings are done by the people that provide those services that we're paying a fairly significant amount of money for. Frankly, I don't want them doing that training. I'm wanting them to learn how to do it, to be able to
perform what needs to be done, as you indicated, as far as the billing and stuff goes, to be able to be on top of it and to make sure that when I go in there and I'm saying if I'm a paramedic and I'm doing the things that I'm supposed to do, that he reviews that to make sure that I've done it correctly. When it comes to doing the training that you're talking about providing, that's a whole different kettle of fish. So I don't know why we're getting so caught up in this training thing.
For me, it's what was said in our job interview, that he knew how to train, he would do training.
I can't
Now,
train, yes.
maybe you're saying you don't want to do it now, or you can't do it now because you're busy, but I'm saying initially, that's what I remember.
But what
The same with
training?
Judy.
Nobody's defined what training you're talking about.
Training is a monumental task, you know, and it's important that we get this onboarding started, that we bring people to task and all that.
I mean, the
You know,
last thing we
after we
want
get
is
up
to
and
have somebody
going.
out there that can't do the job.
Absolutely.
So,
and if it requires having more than one or two people doing training, the most important thing is that when that resident calls for a service, that we have qualified people who can provide those services in a timely fashion and not have to look at a book, pardon my, and say, okay, on page 22, it says, and we've got what, potentially 17, 18 people
that's
that
correct.
we're gonna have to train in a period of 3 days. Because we wanna have all of that in place. We've got a lot of other, I shouldn't say they've got a lot of other things to do between the 18th of September and October 1st. I have no idea. How long does it take to load 2 ambulances completely up so that they can be, I don't know how long that takes. Maybe it takes 15 minutes, maybe it takes 15 hours. I don't know.
Yeah, I would say you have to have them first.
Well,
That's
that, yeah, not that notwithstanding. All I'm simply saying is that the 3 of us, while we have a requirement to, we're representing the taxpayer and all those funds and everything, we also represent those folks out there to make sure that they're getting the best service that they can possibly provide. And I don't think that this getting caught up in all of this, I just get the feeling, frankly, that we've become too anal. Okay, we're Jacob says that we need this or we need that. Okay, we go with that. The trying to understand the thing, it would seem to me that everything that has to be done prior to October 1st, so that when midnight rolls around, we can answer that call when it comes in. We need to be aiding and abetting rather than throwing up what appears to me to be roadblocks and having inane conversations about training, when I believe that they're doing their level best to get all of those people trained, not overload the hospital with 18 people all at one time to try and get the pre-employment physicals and all of that and the background checks, plus those have to be done before the billing company can do their background checks, because they have to be approved and hired before they want to put them in the system for the billing company. Because if we're not going to hire them, why bother to have the billing company do a background check on Jacob Dodd or on Joe Ledger or on Elizabeth if we're not going to hire them? So there's all of these things that come into place, the interviews, and I just think that I don't feel like that we've been as supportive as we probably should be, and that we've been focused on the small picture rather than the big picture. Okay, I said it. That's me.
And that's.
And Elizabeth agrees with me. No, I'm just.
Can I clarify some things on training as far as what's required?
Yes.
Yes, please, yeah.
So you do have to do the initial onboarding credentialing. You have to verify that people are competent, that you've hired, and you have to do that, with any new hire that you have. according to the CQI policy that's been submitted, they have to do that annually with all staff.
And then who does the CQI?
According to their job description, the base manager does. And according to the CQI policy, it makes reference to the base manager as being the person responsible for that.
And is she gonna do that, or? are you gonna
Either
do it?
I or base manager, yes.
So that is the only thing that we require in administrative code is that the CQI policy as it's written, and that's determined by the medical director, is followed. So if it says that it lists out the skills that she wants to see verified, they have to submit documentation to me when I come to do the inspections, the recurrent inspections, that those have been done.
And have you received those yet?
Well, they won't have them done because they don't have people.
No, but the initial, what they're going to do as far as we're gonna do this X, Y, and Z.
If
but
they're gonna do according to what's in the CQI policy, yes, but if they have additional things, I mean, like the image trend and that stuff, that's gonna be kind of that's not really included as part of what's required for us. That's an operational thing that our service needs.
And I agree with this initial training. My concern is after we're done with the initial training, if we have more than the 2 trainers on board, it just seems like, and again, I remember, when you interviewed, it was like Brian was.
Well,
for that
I haven't
position.
heard anything about having more trainers on board.
We don't have any training. But yeah, I can be able to do things after all this.
And then we're
as
fine.
up and going.
And that's why we're talking, so we
Right,
all hear
and
the same
then
thing.
coordinating with the hospital because.
Because I keep hearing we're gonna hire more people to train.
No, that I was bringing in people for image trend and for.
Sure, and that's fine.
And stuff like that, and then having skill stations.
So a year from
going.
now, when people need some continuing education,
I'm
however.
sorry,
A year from now, when people need continuing education, or whenever it is, I'm just
yes,
using a
they
year.
can do this online.
Okay.
Yes, ma'am.
Yeah, and that's the responsibility of the individual provider.
That's correct.
I mean, there's a lot of services that provide educational programs for their staff, but that is an incumbent on the license holder.
I might can weigh in on that too a little bit, like, we can do like the continuing ed and getting them up going with their ACLS, PALS, and BLS. We do have some other evening stuff that we do that they can come in and get credit hours for. Kathy does an EMS, we do an EMS day through the county once a year, so they can do that.
And our
Kathy
county
does
is-
training usually once every couple of months that they.
So there's
can support.
opportunities where they
There's
can get most
opportunities
of
they can
their.
get their hours, but
No.
coming in and being hired, they should have all that
I
certification.
mean, you can do all of it without stepping foot in the class. Right? I just renewed my license this year. I didn't go to any class. I did it 100% online now.
And it is up to the individual to maintain their CEOs. I'll track what they need. And then it's really beholden to the individual to make sure they keep their own credential.
Kathy, can I ask you a question? Is that what you need those cones for your annual?
That's for my first responders, my first responder groups, because every 2 years they have to do some type of writing, and we're gonna use that but that's not.
So the cones might not come back in the same shape, so you're saying?
No, they should come back in some shape. And Brent he says, how are you gonna do it for the space I'm gonna do it? And I said, it's not like I'm driving a fire truck, it's like Rescue 17 here in town, 305, it's like the SUVs that they're gonna be driving. And we just need to make sure they can drive through cones and back up.
Sure.
That's what it is, that's my first response,
Yeah.
it's not the ambulance.
No, I know, but I was just
Yeah,
asking.
no,
I was curious.
EVAC would be, EVAC would be part of the driving.
What does that stand for? Emergency Vehicle Operation Force.
Oh.
How cute.
Write that down.
I will, okay.
And Brian, I think some of the confusion is last meeting, you said you wanted to hire a field training officer. I think that's probably where. the
Thank you,
confusion's
because I knew I heard it
Well,
somewhere.
Damien's gonna help out as part of, these 2 individuals. Damien's gonna help out with some of the training and bringing the EVOC and, gonna be the FTO. field training officer.
He is an on-truck EMT.
That's correct too. Yes, he has, multiple roles.
How does an EMT credential a paramedic?
I'm sorry.
How does an EMT credential a paramedic?
I don't know, you confused me on that one.
So they have to do credentialing checkoffs to ensure that someone is competent to do
For
something.
EMTs.
So, oh, you're gonna have them credential EMTs?
That's correct, yes.
Okay.
See, you just confused. But no, you don't have a lower certify a higher. No.
Right, that's helpful to clarify that.
Yeah, thank you.
What other questions do we have?
I think for clarification purposes to Susie's question earlier, and I may be wrong on this, I'm gonna jump in. My understanding of, because I think the term was used, will vary hourly rates, because these folks that we ultimately will hire that go through the process and the physicals and all that other stuff when it's brought to us will be paid based upon experience and classification. So their rates will vary. We're not paying everybody the same amount
Yeah,
of
that's
money.
what's
That's
been
my
said
understanding.
since day one. Good to reaffirm
I
that.
also understand that neighboring services have increased their rates over the last couple of months too, so that may have an impact on what we see.
And the one thing I'll say about that is, do you have an established table for those? Or are you just picking numbers out of the air?
I don't have an answer to that question.
There's an established table.
Okay, because that's what got Washington County in trouble, was they were just
No, you can't.
randomly picking numbers out of the air. so.
We can't play whack-a-mole with their salaries. There's got to be a table based on experience.
Okay.
Otherwise, we're just
Do you have that available so I can see
picking
it?
lottery.
I'm just curious.
Whack-a-mole.
Yeah, that's probably just downstairs.
Okay.
Well, that's interesting. I didn't know that's what got in trouble, but that's it.
Yeah, they were
Well, I mean,
kind of
you-
picking and choosing who they
Yeah,
wanted
you
to pay, but depending on
can't
whether
do
they were
that.
friends with the director or not.
I got it.
Everything, so that
And
you
I
gotta
know-
back up everything with black and white.
We're asking a lot of questions, but we just wanna all be on the same page
Oh,
because we keep
no.
hearing different
Absolutely.
things, so.
Seriously. Towels. So I have a question, and you're gonna be mad at me.
Okay.
I already know it. Several months ago, I told you that we should probably not have people working in our different offices if they weren't hired yet. It's a huge liability.
Okay.
Yet you have done that.
And I have waivers for those that Chauncey had
You
done.
do, he has not told me that.
We discussed this several months ago, yes, ma'am.
Uh-huh.
Yes.
Can I see
yeah,
those as well? Because that is a huge liability.
Right.
Any other business, Bart wouldn't just let somebody get off the street and drive his car around.
Well, now, wait a minute, Bart, you didn't tell him, I took it home the other day. I even got to play with the.
At any rate, that is a huge liability that you are throwing on the county. You knew that I was very concerned about that, but yet I just heard today you had waivers from Chauncey.
No, ma'am, I discussed this with you several months ago and I
No, you
reached
did
out to
not. No,
Chauncey.
you did not. Not this.
Yes, ma'am, I did, I promise.
Okay, well, I promise I heard you the other way, so we're in
because-
disagreement here, okay?
No, I
But
understand.
you do understand that that is a huge liability.
It's a
Let's say
liability, but-
Chris walks down those steps.
Uh-huh.
She's a pretty clumsy person.
Right.
And she trips.
Okay.
And she doesn't work here, by the way. And that's a liability. We
Right.
cannot have that.
But you know, the same thing applies to the general public when they're going
No, it
downstairs
does.
to go
Well,
to the bathroom.
If somebody is working in your office and you're letting them work there, and they are not a county employee, they're general public, don't you think?
I think that in the conversation that you don't remember actually did in fact take place on more than one occasion, and on more than one occasion, it was expressed that they had waivers, that Chauncey drew up waivers.
He did. And I just haven't seen
And
them.
and he
I
had
kinda
a
like to see 'em.
conversation with
I'd like to
Chauncey.
see them.
Well, and that's fine. He had a
And Brian said
conversation
that
with Chauncey,
he
and
might
Chauncey
give them
said,
to me.
I wish I could get people to work for free in my office.
Right.
I
Yes.
think we're missing the bigger picture. And that is to get an ambulance service up by October.
And everybody in this room wants that to happen.
Right.
Everybody.
And that's what I'm trying to do.
That's why we are so entrenched in worrying about all this stuff.
Well,
Some of it's trivial, some of it's not, but we're worried about it.
and getting this up is a monumental task. And the
And
short
you've done a
period of
lot of
time.
work and we
Yes, ma'am.
appreciate that.
Yes, ma'am. Thank you.
And I know we don't always say that, but we do appreciate that.
Thank you.
Yeah, but
We
Brandon,
just are looking ahead, trying to prevent
Well,
future
no, I
problems.
understand. And that's what I'm trying to do as well.
yeah, Brian, this
Where's
is,
the jar?
it's a bucket now, so we'll have to wait and bring it later.
No.
You know, we're using taxpayers' money. Even the recovery money is taxpayers' money.
Right.
And so it's our job to worry about that.
Understood. And, I was in charge of millions of dollars in projects from the federal government, and I've succeeded without any hesitation or anything like that. So I'm very well aware.
Yeah, I used to work in a position where I was responsible for millions of dollars as well.
Right, understood. But,
No, you didn't.
but trust me to complete the mission. I mean, it's important. Trust me to complete the mission.
I'm looking at the calendar and I'm looking at you too, as far as what kind of a timeline now do we have to have, what can, so things completed, so you can do your job, so we can have.
Well,
ambulance
that's
service?
these, getting ambulances would be nice, and having a time frame of when we can get those would be nice.
Brian, there are 4 of them sitting out at Fessler's, but I'm pretty sure they're trying to get worked on.
Right. But
We work in North Carolina. It says on the side.
the with care leaving, on 11:55 on the 30th of September, it's not time to have everything ready. Well, we need those ambulances back with 10 days in advance.
That's not gonna happen.
It seems like, and correct me if I'm wrong, because I think you were there at the three-legged stool ambulance meeting, we talked about we needed 12 hours ahead. And so the last that I recollect is it was gonna be like a day before.
Well,
Is that, so now do we need to,
we don't know this for sure.
or do we need to call a neighboring county and just see if they could cover for a couple days?
Well,
Okay.
no, it's having 2 ambulances that we had discussed available. And it can be 2 ambulances of any type that can be ready to go, stocked according to what we have on our list. And that way we can get inspected prior to. I mean, we are, pushing this can down the road. And we're butting up right against, October 1st. And
Doesn't give any room for hiccups.
there's
Correct.
a
And-
lot of things that need to be done.
In answer to the question that you just raised, I think the ambulance board has a meeting tomorrow. Is that
It
right?
does,
And I
that's
think
just what I was
that's on
gonna
your
say.
agenda.
Yep.
Uh,
We need to figure this
I
out
think
tomorrow.
10 days, I don't know how we facilitate that, but I just throw a scenario. I'm not going to the ambulance board meeting, but throw out a scenario. And I don't know if it's workable or not. We might have to reach out to, I don't know, Acme Ambulance for see if we can lease, but I'm wondering whether or not the ambulance board, because, and Elizabeth, correct me if I'm wrong here, but the contract that CARE has is with the ambulance board. The ambulances belong to the ambulance board. So Jefferson County has no legal authority to negotiate with anybody regarding getting those ambulances prior to. That's up to the ambulance board and
Right.
CARE Ambulance, because that's who the contractual agreement is with. And it says that CARE Ambulance will provide 2 ambulances to the operator.
And that's where at our last meeting, excuse me, that to clarify,
Right.
it was like 12 hours ahead we get them.
Right.
If we need to change that.
But
we
what
need to have
I'm
a
wondering is
conversation.
just thinking outside the box, and the box may get crushed before I ever get outside of it. Is it possible for the ambulance board to reach out to Care Ambulance and say, hey, we'd like our rigs 10 days in advance. Can you bring 2 ambulances down from your Iowa City operation? And we'll lease them from you at $200 a day apiece or something of that nature. Because the other thing is that you're well aware of, Dee, because I brought it to your attention. We got a refrigerator in one of them that doesn't work. And so we're gonna be taking it out of service anyway, not that it's being used, but my point is that there may be other things that we come across
Right.
that might have to be fixed or something in the process.
So basically, we're inspecting it.
Well, we're wanting to stock
No,
those as
it-
well.
It's not inspection, it's making sure that when we get those ambulances back, we've got to make sure we have comms, the comm guy is in
Or radio,
morning.
yeah.
It's making sure that everything is proper, everything is working. And all these, I mean, you just don't, trust somebody to hand you a weapon and say, oh, well, it fires. Well,
Right.
before I go into combat, I want to make sure everything works. And we got to mitigate this and get some hard dates because we are coming to.
Right.
Now, I don't know that CARE would be willing to enter into that kind of agreement. I'm just suggesting that maybe that's an approach that can be made.
So let's say we got that to work. From your aspect, does that mean when do you inspect them? Like the 12 hours before we start or at that time?
I'll come inspect them whenever they're ready.
Right.
But if we give them back to CARE, we get them 10 days
We
ahead.
don't want to put our supplies in and give them back to CARE.
Exactly.
That's the
So,
point.
so what I'm hearing then is we need to just say, we need them for 10 days before and CARE's
Well,
gonna somehow,
Or some other mechanism to bring some ambulances in here for the.
Either way, we have to be prepared for the what if. And
so I see 2 options there. One is, as you said, CARE, the other is we just reach out to somebody else to say, can you cover us for
well,
X number of days?
this goes back to the inspection. We want to be inspected prior to the first. I mean, that's.
Correct.
And he wants to inspect us prior to the.
And it's-
Yeah,
it's-
so here's where you stand with me. So I need the pharmacy agreement and I need the protocols. And I'll review both to make sure that they meet compliance with code. If there's anything that needs to be changed, send that back.
Right.
Once you've done that, paperwork wise, we're good. The day that I come for the inspection, I'm gonna verify that they have checklists to maintain the ambulances, that they've got drug logs, that they've got all of the stuff that I'm gonna come back and look at when I come back in a year.
Right.
Is the stuff that I'm gonna wanna see then, and then I'm gonna inspect the ambulances.
Right.
And the ambulances have to have everything, I will have a list of equipment based on what I have from the protocols. And it has to have that equipment in it, it has to have stretcher, it has to have some means of communication that can be as simple as a cell phone. If you end up leasing an ambulance temporarily, that ambulance will have to have a current annual preventative maintenance inspection done. The ambulances that you're getting back from CARE already have those, but if you end up leasing from somebody, you will have to make sure that's done before I come inspect it.
The admin part, I'm
Tin
not,
can and a string.
A what?
Does a tin can and a string work?
no.
For communications?
Yeah.
If the hospital can answer on the other end and the dispatch center can answer on the other end, sure.
So,
Long string.
The admin part doesn't concern me. What concerns me is I need ambulances.
Okay, so you need the ambulances. Do we want to have CARE cover for us for a few days? I don't want to give them any more money than we already have.
No,
Just
I'm
my
not-
opinion.
I'm not suggesting. that.
Why, I think you alluded to the fact maybe we should ask other counties if they would be willing, like Henry County, I think I was told they have 4 ambulances.
Yeah, they do that for,
Okay.
But,
3 of them
but
are staff.
the point is, they gotta be inspected. Just because somebody covers for that period of time, we still gotta have our ambulances in order to be inspected.
So we don't need to worry about anybody covering for us. You just want those inspected.
I just
So do
need
we.
to get the ambulance.
So do
Yeah,
we.
I can't issue an authorization until I've completed the inspection. So they can't start responding to calls.
Right.
I get I get where you're coming from, Susie, on the money, but keep in mind that we've been setting aside money for months now. For an agreement that hasn't been lived up to, so that money is sitting there. We can, it's not like we have, and as far as I'm concerned, with all due respect to the ambulance board, I see this in part as their responsibility because they're their rigs and it's their ambulance contract. And so I don't see any reason why those funds to cover the cost of leasing those, if CARE is agreeable to that, wouldn't come out of that money that we've already put aside in escrow.
Okay, so I'm confused. Who are we gonna lease from?
Well, I don't know who we would lease from, but at this point, I would ask CARE if they could bring a couple of their own ambulances for the final 10 days, 7 to 10 days of the contract. And we would pay them $200 a day, for example, per rig for those 7 to 10 days, and get our rigs, well, they're your rigs, the ambulance service agency rigs, get them whatever Jacob needs to
Right.
have done to them done, so that midnight, October 1,
right,
we're ready to rock and roll.
Okay, so.
I don't
So
know
the
that CARE would
ambulance
be
board-
amenable to that, it's just a question. that we
I am
have.
guessing, and I'm only guessing, okay, let's play what if, because I don't know how to respond. They'll either say, yes, we'll be glad to write out a check for this amount. And your point about it, we all have money put away, is a good one. Or they might say, no, that's the
Yeah.
county's responsibility, then what do I say?
To who?
About leasing, because we're taking it on, they might come back and say, the ambulance board.
Have you reached out to anybody about leasing anything?
I have not. I was gonna call them after this meeting.
Do
I was gonna call the world coach after this meeting and get some numbers.
It would be real helpful if we could have those tomorrow, just so we have.
I'll have them today. I
Thanks, just because you're coming tomorrow, right?
I'm sorry,
To
yes,
the
ma'am.
end. Thanks, because I have a feeling it'll be more than $200.
Well, it could very well be.
But-
But I got a feeling that if we go outside of that venue, meaning CARE, that it's gonna be more than $200.
I want to have like an option A or B.
Right.
A
No.
is everybody at the end of this board says, yay, that sounds like a good idea. But if they say, no, that's a county's problem, and that could very well happen.
But it can't be because we aren't under contract. They are.
Correct, but the county's taking the service. It'd be the same that if,
Elizabeth, if you've got a contract, I can't subvert that contract by making arrangements with them to take ambulances in violation of that agreement.
Yeah, I would imagine that the ambulance board would want to negotiate it with CARE,
Yeah.
especially since it's prior to the end of that contract, and so it would be within the contract term. I also just want to point out too, that that money that's set aside, that's earmarked, is technically already already earmarked, like
Right.
for CARE, in consideration of, whatever, I'm not gonna go through all the history
Yeah.
of it. But I would,
Yada, yada, yada.
yes, exactly. I would just say that maybe that money wouldn't really be appropriate for, the leasing of the ambulances, just my 2 cents there.
thank you.
So I've got a question set here. You're not paying CARE money, you're withholding money from CARE, is that correct?
We are putting money in escrow under the advice of counsel, all 3 entities.
We're in litigation, so.
In litigation. Well, then, if you're doing that and you're owing money, why would he even consider giving up the ambulances before midnight of
I
September?
get it, I don't
30th?
disagree with you, but
I mean, you're gonna have to
But in
figure it
answer-
that way.
But in answer to your question, there was an agreement in place that he didn't live up to. And so the reason the money is put in escrow, I'm not exactly sure why, but other than on advice of counsel. He hasn't lived up to the agreement that he made with the ambulance board. He hasn't lived up to the agreement he made in mediation. He's in contempt of court. All of those things are facts. But the fact of the matter is that, we're willing to give him the benefit of the doubt or CARE, or I should say I'm hoping the ambulance board will look at it and say, yeah, hey, maybe this is an option. And he has indicated to me in the past that
he would be willing to work in facilitating the transition. This might be a way to help facilitate the transition. He's been in the business forever. He knows how much is involved in getting those things ready, as obviously as Jacob, both in the context of doing the inspections and in the context of being the person in charge of making sure that those rigs are where they're supposed to be.
Susie,
So we're,
Yes,
can I ask a question?
yes. You
And
can
first,
ask
I want to
two.
make,
You can ask
I want to
two.
make a statement first, and then I'm going to ask a question. So this is not the first time that an ambulance service has transferred ownership of said rig to another, because the ambulances are owned by the Jefferson County Association. All right, we own them as taxpayers. Okay, so I'm trying to figure, here comes my question. And with that, I mean, there was a few little glitches, but for the most part, I think it was a pretty decent and smooth transition. What is the issue at this moment? What is it? I'm asking you guys, are you concerned that this transition is not gonna happen? Are you concerned that it needs to be a different time frame? I mean, why don't you go to them and say, Dee, I'm looking at you because you're the supervisor rep. Say, we would like this transition of ambulances to be 12 hours prior to the midnight deadline. Ask them if you can get out of if they can relinquish it 12 hours early, so this can all take place during business hours.
that's what we've talked about in the
I mean, this
past.
shouldn't be that difficult. This should not be that difficult.
It would be the decision of the
To
three-legged
answer
monster.
Chris's comment, to answer her question that she's asking you guys. Okay, when Kara came in, they had 2 rigs. We had 2 rigs. We had county rigs. Midwest had their rig, so we didn't have to worry about transitioning a rig to a rig. When Midwest came in, we didn't have to worry about Jefferson County ambulance that Ray and Bill had. We didn't have to worry about it because Midwest had their own rigs when they came in. So when we bought from Midwest, when we took over Midwest, we didn't have to worry about our rigs because Midwest took them off to Des Moines. We had our brand new rigs here.
But this should not be this difficult, is
I
what
know.
I'm saying. This is really getting, as a former ER nurse and as a first responder, this should be very streamlined process. You exchange one rig, you get it ready to go, and it's ready to rock and roll as a county ran ambulance service. Then you get rig number 2 ready to do that transition. Jacob already said that those ambulances have been inspected. We know that. We've been through several meetings with that. So you got the first rig's ready to go. If you get a call, the second rig is still under contract with CARE, so it could go respond while the first rig is getting transitioned and switched over. Then you still have a rig that's ready to go irregardless. So there's gotta be some leeway here.
I think you have an answer for your question. Until today, we've talked about 12 hours. Now I'm hearing 7 to 10 days ahead of time.
That would be wise.
So that's the difference. And so I want to,
It's a moving target.
So Jacob, in answer to that question, I can't get licensed for 2 rigs unless I have 2 rigs.
Correct. And that's been the other difference with the other services that you've had come in is they already have a state operating certificate.
Right.
So they didn't need to have a state inspection done prior to starting operations because they were already licensed as an ambulance service in the state of Iowa. Jefferson County Ambulance Service does not.
At some point, I don't know, within around a year into the first agreement with Midwest, they purchased the ambulances from the ambulance board at that time.
well, and I remember last time you were here, please correct me if I'm wrong, you said you're keeping that weekend available in case you need to come in on Saturday and inspect those rigs or whatever day. Yeah, because Sunday's the 1st.
Yeah, and I mean, I can be pretty flexible either way, regardless of when you get the ambulances. Now,
And
I'm gonna say this, I'm gonna preface this by saying that we do not engage in contract disputes. That is not our role. But I can tell you that Bob Libby did reach out to me and he indicated to me that he had received the request to turn the ambulances over early. And that he did not want to turn the ambulances over early because he had not been receiving funds from the county. He had not been getting paid pursuant to.
so he's not going to turn them over early? I missed
That was what he indicated to me. Yes. And I can't force his hand. I'm not engaged in contract enforcement. And I told him that's between you and Jefferson County to work out. And
Kathy, you want to say something?
I already said.
So D,
That's new information, thank you.
so I mean, I hate to say it, but I think I'm not gonna go out so far as to say that Bob is holding you hostage, but he is. And you're kind of at his mercy from where I stand.
so how would you
It's-
work through, what do you suggest if you, magic wand, what should be?
I think it starts with I'm no lawyer, but I would tend to agree that the contract is with the ambulance service agency. So the ambulance service agency probably needs to start the process of saying, we need these ambulances early so that we can get them transitioned over, we can get people trained in them, we can get radios installed. What do you need from us? And if he says, well, I want paid for what I'm owed, work that out. If he's agreeable to a leasing option, I mean, I totally understand the county's position and that they don't feel that he's upheld his end of the contract, but from what I've seen the contract and from what I see in it, he pretty much has rights to those ambulances until September 30th at 11:59 p.m.
So thank goodness, D, you have a meeting tomorrow.
I guess the other wrinkle too is that there are 3 entities too that have these funds in this escrow account, so not that I have to.
You or Chauncey can be there.
Yes. Chelsea will be there.
And see, a lot of this is new information, so this is all
Yeah,
very
you can't
helpful
be
and
there.
timely.
I can't.
Yeah, I'd be happy to come tomorrow. I'm free tomorrow. I don't attend the meeting. I'd
8 o'clock.
be happy to
Except
come
the
answer any
hospital.
questions, but I can't, like I said, I can't force his hand to say, you have to turn those ambulances over to him.
Yeah, if
Because-
you want to, that'd be helpful, because then they can hear from you too.
I appreciate that. I wouldn't want to be. I just, it is. None of us sitting around this table or in this room are naive. We understand that it is what it is. And I agree with your assessment that we are. Well, what's the word I'm looking for? We're not in the best negotiating position.
And so I think I like the fact that you're gonna be calling on leasing, because we want to plan for the worst option.
I totally agree.
And I am not being pessimistic, but we need to have a plan
Yes,
B
ma'am.
or C.
Agreed.
Yeah, you're not right.
It's better be prepared than not. At least for the people of Jefferson County, so that they know that we can answer the call without hesitation.
So, good discussion, thanks to everybody, because a couple new helpful pieces of information.
The other thing that I'll add to, since you mentioned it early on, was with hires and background checks. If you have any applicants that are coming in from out of state, they need to get their Iowa license applied for now.
That's correct.
Because they have to go through a DCI and federal background check that's administered by the DCI in order to obtain an Iowa license. And that takes anywhere from 2 to 6 weeks, depending on how busy DCI is.
Correct.
So,
So
and they
let me ask
can't
you a
work.
quick question, if they were traveling medics or traveling EMTs and they worked here, does that mean they already have a certification?
If they're working in Iowa, they have to have an Iowa license. Yeah.
It's better to make sure they have it.
No, I just didn't know whether or not they were allowed because they were traveling, if there was a different,
They have to.
what do you call it? A protocol.
Oh, yeah, no, they still have to have an Iowa license, so. But that sometimes gets people hung up. They don't realize how long the process can take, and we don't have any control over it because it's administered by DCI. So it just depends on how backlogged they are with other things.
Right.
And that's been it. We have a lot of problem with border states that hire people from Missouri or Nebraska or Illinois or Minnesota. And
Right.
they're like, we need to get them on a truck, and they can't work until they've been granted an Iowa license, and we can't grant an Iowa license until they clear the federal background check, so.
We gotta get this moving, so I gotta use my voice.
Go ahead, go ahead.
You sure?
Yeah, absolutely. Keeping track.
You're what?
Nothing.
Me too.
Yeah. You can invite Lisa.
I will. Oh, I didn't start a fight before, right?
Yeah.
It's my fault.
How is
Good
it?
to have everybody in the same room,
So how did they sign this?
isn't it?
Yeah.
So
No, I'm
under
just kinda like-
state
Yeah.
policies or whatever, they're all going through the same side of the gate. $15 per person. Because, I mean, we're capable of funding, but we can only do that.
My concern,
And I
Go ahead.
rest or job.
concern was just prepare.
Yeah,
for
But we're not allowed to check just anybody, you know what I mean, when we run that?
Yeah, so we don't require the background checks for hiring. But if they received a state license after 2019, I think was when the law changed. When they apply for their initial licensure, they have to submit fingerprints and they run them through the NCIC and FBI criminal databases. And I think it's like $110 as part of that
Per
licensing fee. Yeah.
Wow.
And then once but they only do that once. So if they have anything that happens after they get their license, the only way we find out about it is if it gets reported back to us by an entity. So that's why we still
But
encourage
they
people to do
still,
it.
I think they still have to go on that site and get it going, because we fingerprint people all the time for certain
Yeah.
employment,
Yeah,
but they're bringing in the cars.
yeah,
Yes.
yep, that we do the same thing. When we send out a license application packet, so anybody that's enrolled in an EMS training program, when they get to the end of it, or if they're a new person coming in from out of state applying for a license, we give them a packet, and part of that is a fingerprint card that they have to take to the local police department.
That clearance,
Go what?
They don't go through the field stack then, like what the Board of Education, they have, we had like go to Mount Pleasant because we went to, what's it called, field stack.
No, ours,
you're not gonna get that clearance date on those. It could be 2 months.
yeah, we've had them take that long before. It just depends on how backed up PCI is. Yep,
Because we have to do the same thing, send anybody through the academy.
yep.
So it could take 2 months before you see them.
Yep.
Are you saying somebody's?
Which I think you can call and maybe get them ahead of time.
If you have anybody that's applying from out of state that doesn't have an Iowa license.
Probably.
Yeah, it takes a while because we wait for those to come back too. Obviously, we can proceed, but
You know,
wants
appreciate
that date that we. they clear.
Oh, yeah, it's Monday.
Yep, that's
Still
exactly what we do.
optimistic.
In fact, our whole system was modeled off. of
Friday
the law.
afternoon.
Yeah, so, yep, they borrowed a lot of their policies when they set it up.
They
that way.
said that Jeff Dunham had a show. That was something chaos.
Usually evidence.
Controlled chaos.
Yeah, so we don't do all that. That's all up to individual employers to decide their physical and mental aspects of it.
Now, was that a lousy throw or a lousy catch?
Shade Academy, I mean, it's.
You can have one of them.
Yeah, I mean, they have to have the medical form on there that has to go when they go.
Okay, so here we go. Brian,
Yes, ma'am.
I asked Chauncey about the waivers. He said he did discuss it,
Yes, we did. Yes, ma'am.
but he did not produce any. Nothing has been signed.
I have the waiver in my inbox.
He says, I have not drafted waivers. I don't know what other waivers have not been drafted or signed.
Okay. But I have.
So is that in the personnel files, what you have done so far?
I have the waiver in my inbox.
And so these folks you want to hire, have they signed a waiver? No, like, excuse me, the ones that are downstairs working anyway. Have they
No,
signed a
they have
waiver?
not signed the waiver, no, ma'am. They have that.
Again, I'm concerned about the liability, and you know that.
Understood, yes, ma'am.
Where'd the list go? You run people off on a daily basis.
Oh, I don't know.
They're out there.
Got a phone.
Okay. So,
Makes her legally president, the phone's here.
what?
Want me to get her?
Or Chris are out. They're coming out, yeah.
They're probably talking about nothing related to this.
We're talking
She
about
actually had a
that.
question about the back assessments and all that, is what she was asking.
Mhm. I just think today's the day to figure it all out. Anybody else have anything they want to add to this for the good of the order? Any other questions about the ambulance?
Suzie,
Yes, ma'am.
I have to say on behalf of the residents of Jefferson County, as the public health director, the ambulance board, the hospital, the city, and the county need to figure out how to get those ambulances transferred to the county, like 12 hours or a day, 48 hours, something before. I don't know if they need to consider buying out his contract 48 hours early or something. But I'm just throwing out suggestions as a professional. I don't understand the issue of leasing something, because then you're gonna have to have I do, but I don't, because then you're gonna have to have that next level of inspections, cost, et cetera. So I would ask that that there's some discussion about that to help facilitate this transition from the current ambulance service to the new service in a comprehensive way that doesn't have to be so convoluted. And when you've never lived in this world, it is a whole different language. But I'm here to tell you, as a taxpayer in this county, and as someone that has the best interest for everyone, this needs to be done sooner rather than later. And it needs to be done with respect and dignity to the current service and to the services coming in. That's it.
I don't think there's a person in this room that doesn't just agree with you. I disagree with you, sorry. But thank you for that, Chris.
You're welcome.
And the challenge with that, because the board, that's what the last meeting had agreed on.
Yeah.
The 12 hours. So today we were hearing
Back
7
in,
to 10 days, but
I don't think you're probably gonna get that, but I would request, 48, 72, something to buy them out of their current contract.
and then we
Something.
still need to figure out how to cover that 12 hours or that.
Well, like I said, you could do one, you got the backup rig from CARE, you could transition, take one ambulance out of service, because we all know that there's not 2 ambulances running 24/7 in this county. So actually, that would be a benefit at that time of transition. I'm sorry, I can't be at the meeting tomorrow, I'm out of town going to ISAC, otherwise I'd be at the ambulance meeting as a member of the public, but I'm not available. I'd whip out my official hat and speak to, and say the difficult things that need to be spoken.
I think the ambulance board understands.
I'm not saying that they don't, but
I totally agree. It's very urgent.
they've never worked in a capacity of life and death, and that's a whole different ballgame.
Yes.
And I'll add, I'm sure they're aware of this, but there's no statute in Iowa law that requires ambulance service. And while my job is technical assistance and I am doing everything I can to help you guys get this up and running, I can't sign off on a service until it meets the code. And if that doesn't happen by 11:59 on September 30th, and Bob pulls his staff out of that building and says, you're on your own, at midnight, Jefferson County doesn't have an ambulance, period. So like I said, I'm more than happy to come to the meeting and reiterate that tomorrow. But I don't have any leeway on it. I can't authorize them until they've got everything in place.
And, Jacob, I understand that. It's your job. So
The only saving grace we have at the moment is we do have, I don't know what the technical license is, Jacob, you could tell me, but with the fire department, with the city, they can't transport, and I know this, but there isn't any reason why, correct me if I'm wrong, I'm hoping I'm not, there isn't any reason why we can't put a paramedic on the truck.
They're not authorized at the paramedic level.
Right.
They don't have a paramedic authorization.
Okay.
That's why it's important to either get the ambulances back early.
But if the first responder paramedic happen to show up, then
They have to be we don't have paramedics, EMTs, they don't have independent practice authority. They have to be a rostered member of an authorized EMS service functioning under a license.
well, I thought I'd ask.
Are you gonna come tomorrow?
Yeah.
Okay.
Yeah.
Thank you very
What
much.
time is it?
8.
At the
hospital.
hospital where it normally is? Okay.
Yeah.
Unless they move the hospital. I don't know that they have.
Oh dear.
Once they get the roundabout fixed, I can go check for you and see.
Yeah, don't try coming through Fairfield first. Go around.
No, I've learned that the hard way already. Yeah.
So,
Stop sign would be.
do you have any other issues or things you want to say to Dee before she goes to this meeting? Speak now or.
No, I got faith in D,
Before.
I'm just not sure about your chair.
Okay, let's be nice.
I just talking about the chair that she sits in. You said something.
Message taken.
Yeah. Lee, Dee, do you have any other questions?
That's one, again, thank everybody, so it helps to talk these
Yeah.
things through.
Brian, I do have another question.
Yes, ma'am.
In your operating budget,
Yes.
you've approved these, you have money for these positions
That's correct. Yes, ma'am.
and the early hiring of them.
That's correct. Yes, ma'am, I do.
Any more questions? Next item is on the agenda is to discuss and consider resolution to hire Damon Wimmer, Jefferson County Ambulance Service. For what position? The resolution says it is moved by blank, seconded by blank, that the Board of Supervisors of Jefferson County approve the hiring of Damian Wimmer as a full-time EMT, FTO, FVOC trainer.
Eva. The FTO is where he's going to be brought on as far as training the EMTs that we have, and map testing and making sure they're doing their job properly. And EVOC is doing the emergency vehicle operation course and maintaining their race certifications.
Okay, so if I could continue with the resolution. Vehicle maintenance off-site effective September 1st, 2023 at the hourly rate of $24 an hour. How did you come about that figure?
24 is based upon his experience as an EMT. He's been an EMT for over 10 years. Field training officer rate and what he brings to the table as far as EVOC and other training and maintenance of the vehicles that he's done before.
Out of all the people that you've interviewed, why does he rise to the top? What?
He's the most qualified.
You know, I asked you once if I could look at your applications.
No, I don't believe you asked me that.
What?
I don't think you've asked me that.
Yeah.
Yeah, she has.
Okay.
Just in an effort to help you guys, it's what I used to do. Just like Dee used to be in the medical field.
Right.
So any input she has might.
No, I appreciate any guidance, but I think I'm pretty qualified.
Okay, so you're not gonna show me the applications.
I didn't say that, no.
Okay,
I mean, I will gladly show you the applications. but
okay, I'll ask for that again. Along with your scale of hiring for folks, just so we don't
ma'am.
get in trouble.
Can I ask a question?
Absolutely.
So I asked earlier, you said he was gonna train EMTs. Are you gonna hire an FTO for paramedics too?
Yes, I am.
Tell us again what
I
a
thought that was in
PTO
your
is.
job
Field training
description.
officer. I'm sorry?
I thought that was in your job description.
I can't do everything, sir. I don't know why everybody thinks I can
Why are we
train.
fighting on
admin
being?
and
Well,
all this other
he
stuff.
said earlier that he had a waiver for those that was down there helping. Now we find out there's no waiver. I'm sorry, but I'm losing trust in him. He can't earn his trust when he can't tell us the right things here.
You know,
I'm public sitting out here seeing this.
so come October 1st, when we don't have people on staff and we don't have people trained,
Well, if they're EMT or paramedics, they should already be trained and stuff. It's just what they're requiring here with this company.
yeah, we're requiring a level of training and what's what I'm looking for, requirements from the state. What do you call those things? The Q.
On staff on board credentialing
Yeah,
and CQI.
so we're required to do that. Just because they're certified as a paramedic doesn't mean that we don't have to do that. And those things have to be done. I don't, I get the impression that everybody seems to think that, well, we can flip the switch off over here and stop doing this and move over here and do all of this. In the meantime, we don't talk to anybody about potentially leasing an ambulance. The question was a legitimate question, but the question was asked, why the 14th, 15th, and 16th? That happened to be the dates that Image Trend and AMB, the billing companies, were available to do on-site training. It wasn't something that we just magically pulled out of the air because we were trying to screw the
Hey,
public.
I want to say something. When I asked that question, I hadn't been told that.
No, that's
So I'm
fine.
just asking for
And
knowledge.
I get that.
Because
But my point simply is that I'm saying that we just can't flip a switch and stop doing this thing to go do this thing. But these things all need to be done in the span. We're talking about here, what's this, today is the 21st, so we've got a week and a half here we're looking at 5.5 weeks. This is all got to be pulled together.
so one thing that leaves made me think of, all these people you want to hire, Brian,
Yes.
that are coming on, they already have some level of training. They aren't all
They
gonna
have to be
right away.
trained specifically.
Even though they
as-
just left the job 2
It
weeks ago, they
doesn't
need
matter.
training.
Jacob? Do they not have to have
They-
all of these credentialing?
Okay, I'm gonna be honest. This is not a full-time position. Okay,
What, oh, you aren't? Okay, sorry.
no, the requirement for training as it's set with the CQI policy is not a full-time position.
Right.
The CQI policy states that the base manager is responsible for ensuring the competency of the staff. That's what their CQI policy says.
Right.
And I've seen the base manager's job description, and it says that that's part of their
And I'm
responsibility.
perfectly fine with that. But what we're talking about, I don't get, what I'm trying to get across to everybody is that you're gonna bring in 18 people all at once and expect one person, first off, to get all of the stuff done at the hospital and everything. We're doing these pre-employments, kind of piecemeal, so to speak, so that we didn't overload the hospital, but to meet the requirement the last time that these names came before the board, so that they had all of that paperwork done before we approved the hiring. So we jumped through those hoops. Now we've got something else on the table that we're gonna throw out here. Why don't we just wait till September 30th to hire everybody and be done with it? I'm sorry, this is ridiculous.
Can I ask a question of clarification?
Kathy had asked for.
I wanna say something. Wrong, Jacob, on other places. Those 3 days you guys are doing your training, that's everything that's with all your image trend, everything. When we have new people come in after October 1st, we hire an EMT here. That EMT needs to know the rigs, needs to know how to work in image trend and such. That's what the FTO does. They work with the new ones that come in. The FTO may help with the skills, like Damien, if you approve him, he may help with the skills. But then once you hire someone after October 1st, he's gonna be the one because they're gonna follow them like little puppy dogs. They're gonna be on the rig. They're gonna be the third person on the rig until we know, yes, they can do this, they can do backboarding, they can do all the things. They know where all the equipment is. They know how to run the equipment. That's what the FTO is going to be for mainly, is after October 1st, when you got new ones coming in. That way, when you've got Judy and Brian working on all the other administrative things that you guys are asking them to do, they do this. Then after they're signed off, saying, yes, we feel comfortable, then they run at least one shift, if not two, with Judy or Brian to get the final checkoff blessing. Yes, they are able to be on their own. That's what the FTO is set up for, is when you've got new people coming on, they're the ones that are to do the.
You say that in the CQI, that's the base manager's job.
She will officially check that off.
I'm just asking a question.
I'm just trying to understand, I mean, from what I understand, the proposal's been made to hire an FTO. And the person that's been picked to be the FTO is an EMT. My question as a state regulator is, how does an FTO that is certified at an EMT level verify competency on a paramedic?
We just had this discussion because he's an EMT. I have EMTs that are coming on board.
But you employ paramedics too.
That's correct. Paramedics will FTO paramedics.
So my question as a taxpayer is, why are we gonna pay two people for FTO
Bingo.
education when you could just pay the one paramedic to do both?
Okay.
Just my question as a taxpayer, it sounds like a waste of money to me.
Okay, one at a time, let's kind of.
I'm gonna take my state regulator hat off for a second and I'm just gonna say this from an outsider looking in based on what I've heard so far. And you guys are starting a new service. You've got an operating budget for your first year.
Correct.
And you think that's what it's gonna cost you. You have projections on what you think you're gonna have for revenue. And I'm gonna tell you, based on what we see on other news services, not just locally, but around the state, whatever you think it's gonna cost you the first year, it's gonna cost you more than that. That's a given. You won't make as much money the first year and you will have more expense than what you encounter. Quite frankly, the administrative team that you have in place is a luxury for most services this size. And adding more people to that administrative team, I mean, I'm just gonna be blunt. I managed a service that runs almost 3,000 calls a year, and we did it with 2 people. We didn't have administrative assistants. We didn't have FTOs. There were certain tasks that were split amongst the staff. So I'm just trying to understand why it is that if you're gonna hire, I'm kind of like her. If you're gonna hire a person to do the job, then they should be able to credential all levels of providers.
And I'm struggling with hiring anybody else. I know we're top heavy on having enough to luxury
2 people doing this job.
to have a director and a base manager, because if you take like the private entity, and I know we're not, but just for the example, we had a base manager locally. And then all the administrative, like the billing and that stuff
I
happens
invite
elsewhere.
everybody to come down there and see how much work is involved instead of judging from everybody's standpoint, to come down there and see what the hell is going on.
And that's the reason that we, the board, agreed on a director and base manager position, is because we knew initially there'd be a lot. However, going forward, we're gonna have a hard time even justifying, I mean, we're gonna need,
If I am within my budget, let me operate within my budget.
well, and the budget, and we as a board didn't push back enough, because, but we know it's a new service, we know there's some padding in it, and we usually don't like padding in any kind, but we understood there'd be some extra
Let me,
costs.
look, I have a budget. Let me operate within that budget, okay? Let me get the service up as agreed.
You know, Brian, we're not gonna sit around and not tell you what we think if we think.
No, and I appreciate it, but I mean, you give me a budget, okay? And you say, okay, operate within this budget and get the job done. I am doing that. Let me do that. Because, you know, I mean, you guys faith in me, you know, seriously.
Chris,
I just want to say that I understand that this is a new service. I also understand I've been in county government for almost 16 years. And what one budget, you're just one little piece of the pie, Brian, like I'm one piece of the pie, like Bart, like any other county department. Historically, what happens though, is we all have to give something up in order to get something. And the departments that have given up don't have anything else to give you next year.
right,
I'm telling you, my budget is about, as Joe can speak to that. My budget is so freaking tight right now, I don't even know if I'm gonna have enough money, I'm probably gonna have a budget amendment.
right.
So when the supervisors are looking at our departmental budgets that they've approved, and I'm sitting on an extra $10,000 because I didn't have an IT issue or something, they're looking at that throughout the whole year. And then if somebody runs short, they're gonna say, hey, this department ran short. I'm here to tell you, there's 4 people in my department, post-pandemic, I didn't get to hire an office manager.
Right.
So all that responsibility falls to me.
Right.
So I get where you're coming from as a department head, but I also see where the 3 of them are having a
Right.
discussion, because they're trying to keep everything afloat.
Correct.
And I've been in healthcare a long time too. And like Jacob said, it's gonna cost, it's never gonna be in the black, it's always gonna be in the red, or we wouldn't even be having a county ambulance discussion.
Right.
They'd still stay in the private sector. So I see all this, but I will say this from a former education manager's position at the hospital, that you would not hire a nursing assistant to do checkoffs with registered nurses and physicians.
Correct.
Okay, I'm going to do that as an RN with a bachelor's degree and certifications to teach X, Y, and Z classes, of which I no longer teach. Shelley does that. But I'm just saying, it's not a personal thing. It is to get the best return on your investment when you're hiring said employee. I mean, I've worked with some of these people. I have a great professional respect for them. But when you're looking at it from a strictly business model, it is very challenging because there's no more money to come from any of the rest of our departments.
Right.
I don't know what else to say. I might have just spoke out of turn, but I'm just telling you that Abby was shaking her head. She knows. She sees everybody's numbers. So it's nothing, and it's like an orientation process when we, and you know, just because I get done with nursing school and I'm gonna go work in ICU, psych, ER, whatever, I'm gonna have to take all of those credentials underneath that umbrella of a critical care nurse or trauma nursing core class, which I've taken, you know, all of those things come with time and on the job training. So I don't know what that looks like, because you're gonna have to have ride-alongs and all of that stuff. So yes, you're gonna have to go through all those scenarios, but you're gonna have to have somebody that is licensed that can do everyone. That's, I mean, it's no disrespect to the individual's name that's listed, but you gotta get the best return on your investment with staffing, because like, I don't even have an office manager. So I'm, you know, when I'm looking at that post-pandemic, when I'm doing all the administrative things that should be done by an administrative assistant, I don't have that luxury, Brian.
Right.
So
Chris, didn't you go, you're actually down 2 people.
we're down 2 people.
You know, there've been a lot of departments that,
So I'm just for the, not for the good of the order, but for my department and as a taxpayer, that's where I'm at. That is where I'm, everybody in this room knows how snarky I get at budget time, because I'm fighting for my own department budget, as we all should.
Right.
But that's where we're at.
Well, see, the only thing I want to bring up
Sure.
is with, okay, EMT, okay? He's in the driver's seat. You got a paramedic that's supposed to be the one that's training him. How is the paramedic gonna be in the back training him when he should be in the front? Because there's two different, you know,
But why shouldn't either the base manager be in that, doing the training when that's in the job description?
so you want the base manager to do all the stuff with the building and run every call on the truck. That's what we're talking about.
I
every
think you
call
were
on the
doing
truck.
it.
I'm just saying, all the jobs that you have Judy and Brian doing, they are expected to run every call on the truck too when they have an orientee. Because that's what the FTO only helps out in the field with what we're going.
I'd like to point out, I did that. That was my
Other
job.
Services do it.
I did,
Yeah.
I did all of the CQI stuff. I did all of the training for our staff. I did all of the onboarding, and I managed continuing education for 5 volunteer first responder programs.
You were the director and you had.
No, I was the operations coordinator, and that was my job as the operations coordinator. I was basically the base manager is what I did. And then when I became the EMS director, I handled budget and policy, and my operations coordinator took over those roles.
Okay.
And that's how Washington County's is structured. That's how Lee County's is structured. And those are, I mean, Lee County is obviously a much bigger service. They run 6,000 calls a year from 3 bases, but
And they basically have 2 counties in the county.
yeah, pretty much.
But
Large geographic.
that's why we're questioning it. We're not questioning you, we're questioning. And I know, because other people have heard me say this, and they, you know, I check around, I see what other people are doing.
This
And like
is a-
Jacob said, other people have,
This
this
is a
is a
new,
luxury to have.
this is a new service that requires a lot of, it has to be built from the ground up.
Okay, help me understand this, maybe this will help. If I ask this, so now that we'll have however many new people, let's say 17. So would this position be riding with each of those 17
For the EMTs.
for like the month of October or what? I mean, how does that look?
Yeah, as they come on, yeah, it'd be training, it'd be helping to train those, yes.
So what I'm hearing is there is training on the 13th, 14th, and 15th, or whatever the days are.
Correct.
Because that's when image train.
And then there's truck training, basically.
Correct.
Okay, I guess my concern is after the initial period. Why are we paying somebody to do a training job when we don't have an influx? You know, if this is like a temporary, you're gonna do this for the first
Right.
month, I can do that, I can maybe agree with that. But if it goes away after that, I mean, because I know we're starting a lot of people, I understand that, however, this would be ongoing, and I don't think we need that ongoing, so I don't know how that looks structurally, and I'm looking at you, Elizabeth, is that like a, I don't know, but that's a Jack question, not a you.
Yeah, I probably want to talk to him about that.
It just seems to me as probably the first month, it's gonna be pretty much the base manager's job is to ride into training.
Well,
We'll have the supplies, yeah, there'll be some other stuff to do, but you won't have the results yet to analyze as far as the data, so it'll be a lot of making sure everybody's inputting the charting correctly and in a timely manner. I don't know, I'm thinking of logistics.
That's when Washington County started their service, that's exactly what they did. Was the assistant director was responsible for the onboarding of the new people. Because that happened right when I first went to the state. We worked with them very closely on that.
I have an interview here in just a few minutes.
Okay. So what is it we're gonna talk to our HR about?
Oh, no, I was just, if we hired a temporary, but I just keep hearing this is the base manager's job, unless I've misheard.
So Dee, are you saying we should table item 6 and 7 until next Monday or in a few days to?
Tell us about the other position. What would they be doing? Because I don't know anything about that one.
Well,
Why do we need an EMT September 1st?
we'll just table this because till next week.
Okay, you want to table both until next week?
Yes, ma'am.
Okay. Are you good with that, Dee? I'm good with that too. It'll give Brian more time to think about what we said, for us to think about what we said. Update from Jacob Dodds. Anything else you'd like to tell us, sir?
No, I think that's pretty much, I think we've covered it as far as what I still need and what's gonna be required to finish the authorization process.
Okay. You know, I know everybody here and everybody there is, we don't want this to happen.
Oh, I don't doubt.
You know, oh my goodness, yes.
Like I said, I think the biggest hurdle right now is the situation with the ambulances, and that's gonna be the one thing that you're gonna have to come to some sort of an agreement with Bob on.
Yeah, be really nice to Bob. Anyway.
And to follow up on that, I know that our chair has been trying to talk to him, but since we have more of a county interest in this, I may ask to help facilitate that.
Okay. Okay. Jacob, anything else?
No, unless
Do
you've
you
got
anything else?
any specific other questions for me. I can address, he left, but I mean, I can address a few things that Brian sent me questions about. One was whether or not we required physical assessments. And the state does not require that. We do have it within our rules that if a licensed healthcare provider deems that a certified EMS provider is mentally or physically unfit to provide service, that we can pull their, we have the authority to pull their license, but beyond that, that's up to individual employers to decide a physical assessment process. I gave him some examples of every place I've ever worked, I've completed one. I gave him some examples of what that was. It involved performing, usually you had to carry a cardiac monitor and a fully loaded jump kit up and down 3 flights of stairs and then perform 3 minutes of CPR. We had to we had to put a 75-pound weight on the foot of a cot to simulate loading the patient under the back of an ambulance. We had to do a dummy drag with a 150-pound rescue dummy. I mean, it's stuff that's pertinent and relevant to the job.
So you did that at what point?
That was part of the pre-hiring process.
Was it the physical or separate from that?
It was separate from that. It was administered by on our own people. When we brought candidates in for an interview, that was part of the interview process, was a physical agility assessment. And then if they were approved for hire, they went to an occupational medicine specialist and had a full physical done, including drug testing.
That'd probably make more sense than trying to schedule all these people.
Yeah, if you have samples of those specific assessments, would you mind emailing them to me? Because I'm trying to kind of facilitate these.
Yeah, I mean, again, these aren't
screenings.
required things. These are just the things that are out there that places are
Just
doing.
so that we know what's available and what maybe we should be considering in addition to what we're having the hospital do.
The worst thing is to end up with a situation where you hire a candidate and find out that they're not capable of lifting and moving patients. I mean, that's a core part of the job.
Try to avoid that for sure.
If you could help facilitate.
Oh, yeah,
Wow.
absolutely. No
I
problem.
couldn't lift 150 pounds.
That's why you shouldn't apply for any.
Fortunately, you don't have to lift it. All you have to do is drag it.
Oh.
Lift it.
Like
pick it up,
downhill, I could
and
probably
drag
do
it.
that.
Roll it.
Most people.
Yeah, roll it, yeah.
But I'm 42 and I've been doing this since I was 19 and there's a reason I've moved out of the field. I'm getting old. My back and knees don't
At
work like they
42.
used to. It's a young man's or a young person's game.
Yeah. Well, anything else from anybody? To quote Chris, for the good of the order. Okay, I think we were at committee reports.
Yeah, I had a couple in interest of time.
Jefferson won her second game.
Thank you.
Oh, yeah, no problem.
Thank you, Shelley. Thank you, Kathy. Thank you, Chris.
I was on the Dozier dart.
Sorry, I spoke out.
That's what you said.
What?
I'm sorry if I spoke out. I just.
No.
I'm going home
No,
and get on it
Elizabeth
again.
left.
It's hot out there and it's got air conditioning.
I'm gonna say it.
It's hot,
Close it.
Can you
It's kinda
recommend
noisy.
it?
it's hot comfortable, so.
Yeah, that makes a big difference if you're
That
sitting
makes
in
a
the conditioning
Yeah,
versus being out in it.
Well, I got on the tractor, the blade leveled stuff off. Just being out for 15, 20 minutes was miserable.
Anyway,
Well, was I out of line, Susie?
you're always on
You're
line,
still
but
on the
this
meeting.
came, you were fine. You were fine. Everybody's got a right to their opinion. I think last week, Dee did spotlight.
Oh, yeah, I did.
We had a
spotlight.
department head meeting.
Yeah, wait a second. I need to get these looked at. And then I did a medical assistance advisory committee meeting Thursday. And they're actually making a lot of progress at the state with the Medicaid, which is exciting.
Unbelievable.
I know. It's a long process, but anyway, they are. And there's a new dashboard and they're gonna announce it tomorrow, so watch for the announcements, but basically you can go into your own county because they were showing this to us. And one of them, they just happened to pick opioid ER visits. So I wrote it down, there were like over 1,000 in the state. In the last quarter or something. Anyway, apparently you can go into county level and look it up. And I thought, well, that would be good data for us to have going forward. So that database will be interesting to see. And this is because somebody asked if it was just Medicaid visits, but I think it's all ER visits. And they talked a little bit about the redesign of the Department of Health and Human Services. There's going to be a new acronym, Hope and Opportunity in Many Environments, which stands for home. And the other thing they're doing is they're trying to redesign the waivers at the state level for more streamlined pathways. So that's where they're actually making progress. Okay, I am gonna make a motion that we approve claims for $64,390.80.
Repeat that, Dee.
$64,390.80.
I'll second that motion. All those in favor? Motion passed.
Motion to adjourn.
Motion adjourned. I second that motion.
All in favor?
All in favor?
Thank you, everybody.
Aye. Motion, we are adjourned.